Good evening and very warm welcome to everyone. On behalf of Ayurveda, it gives me immense pleasure to welcome you all to the second day of Niramaya 2026 National Seminar Paper and Poster Presentation. We are delighted to see the continued enthusiasm, participation, and academic spirit that each one of you has brought to this seminar. The success of the first day was made possible by the valuable contributions of our presenters, the guidance of our esteemed panel members, and the active involvement of participants from various Ayurvedic institutions across the country. Without us, I would like to extend a special and heartfelt welcome to our respected panel members. Your willingness to share your expertise, provide constructive feedback, and support young researchers has been instrumental in maintaining the academic quality and integrity of this program. We are truly grateful for your time, dedication, and continued support. I also warmly welcome all principals, professors, faculty members, research scholars, practitioners, and students who have joined us today. Your presence reflects a shared commitment toward the learning, research, and the advancement of Ayurvedic science. As we gather here for another day of academic exchange, let us take a moment to remember and honor all those great teachers, scholars, researchers, physicians, and visionaries who dedicated their lives to the growth and preservation of Ayurveda. We respectfully remember those who are no longer with us. Those contributions continue to guide and inspire generations of our Ayurvedic professionals. Their knowledge, dedication, and service remain a source of inspiration for all of us. We would also like to acknowledge and appreciate everyone who has contributed to the growth of Ayurveda through their research, teaching, clinical practice, and academic service. Every contribution, whether big or small, plays a significant role in strengthening and advancing the timeless science. As many participants have requested access to the previous sessions, we are pleased to inform you that the recording of our earlier academic programs and sessions are available and will be shared with the interest participants. We hope these resources will continue to support your learning, journey, and academic development beyond this seminar. Niramaya was conceived with the vision of creating a national platform where students, scholars, academicians, and practitioners can confidently present their ideas, research findings, and innovative perspectives. Through paper and poster presentations, we aim to encourage scientific thinking, strengthen research culture, and promote meaningful academic discussions with the Ayurvedic community. The presentations we witnessed yesterday demonstrated the remarkable talent, dedication, and research potential present among today's Ayurvedic scholars. We are confident that today's session will continue this tradition of excellence and provide further opportunities for learning, interaction, and professional growth. As we begin the second day of Niramaya 2026, let us approach today's session with curiosity, enthusiasm, and an open mind. Let us learn from one another, appreciate diverse perspectives, and work together toward the advancement of Ayurvedic knowledge and research. Once again, I extend my warmest welcome to all our respected panel members, faculty members, presenters, participants, and guests. Thank you for being a part of Niramaya 2026. Without taking much of your valuable time, let us now proceed to today's scientific session and begin with our first presentation. Thank you, and I wish you all a productive, inspiring, and successful day ahead. First, we go to the poster presentation. I would like to invite Dr. Samrudhi Ashok Choudhary for the poster presentation.
Good morning, all respected judges and delegates. I am Dr. Samrudhi Ashok Choudhary. Today I am presenting a poster on post-COVID rehabilitation through Panchakarma therapies, detox, rebalance, rejuvenate, and restore. This poster highlights how Ayurvedic Panchakarma can support recovery from long-term physical and psychological effects experienced after COVID-19 infection. Although many individuals recover from the acute phase of COVID-19, a significant number continue to experience persistent symptoms mentioned on the left side, such as fatigue and weakness, breathlessness, poor immunity and recurrent infections, cough and congestion, anxiety, brain fog, stress and poor sleep, loss of appetite, indigestion, muscle and joint pain. According to Ayurveda, this manifestation can be understood as the result of mentioned below arm accumulation due to impaired agni, dosh imbalance, particularly Vata and Kapha aggregation, Strotaroda or obstruction of bodily channels, Dhatu Kshay or tissue depletion, reduction of ojas, the essence responsible for immunity and vitality. Therefore, management should not only focus on symptom relief but also on restoring systemic balance and strength. Panchakarma offers a comprehensive approach for these purpose. On the right side of the poster, I have explained how Panchakarma helps. Panchakarma is more than a detoxification procedure. It is systemic therapeutic process that cleanses the body and restores physiological equilibrium. Now, first point is detoxification of the body. Panchakarma eliminates accumulated toxins or harm and clears microchannels known as protos. This improves circulation, nutrient delivery, and waste elimination. Second is restoration of dosha balance. COVID and its treatment may disturb Vata, Pitta, and Kapha. Panchakarma helps restore their natural balance and thereby improving overall health. Third one is strengthening immunity. By enhancing Agni, nourishing tissues, and promoting ojas, Panchakarma improves the body's resistance against infection and supports long-term immunity. Fourth one is improving respiratory function. As Panchakarma clears all the channels, it helps respiratory passage, reduce inflammation, and improve oxygenation and lung function. Fifth one is enhancing mental well-being. Now, mental health concerns such as anxiety, insomnia, poor concentration, and mood disturbances are common after COVID. Panchakarma therapies calm the nervous system and improve psychological well-being. Sixth one is restoring energy and vitality. By removing toxins and nourishing depleted tissue, Panchakarma helps reduce fatigue and restore physical strength and stamina. Below that, there are key Panchakarma therapies and their benefits for post-COVID symptoms. First one is Vaman, therapeutic emesis. Vaman is primarily indicated for aggravated kapha conditions. In post-COVID patients with excessive mucus, chest congestion, and respiratory heaviness, Vaman helps clear cough from respiratory tract, thereby improving breathing and reducing congestion. Second one is Virechan, therapeutic purgation. Virechan eliminates excess pitta and cleanses the liver and gastrointestinal system. It supports metabolism, reduces inflammatory processes, improves digestion, and enhances immune function, which is particularly beneficial during post-viral recovery. Third one is Basti, that is medicated enema. Basti is considered that most effective treatment for disorders. Since many post-COVID symptoms such as weakness, fatigue, muscle pain, joint pain, and neurological complaints involve Vata activation, Basti plays a central role in rehabilitation by restoring strength, mobility, and tissue nourishment. Fourth one is Nasya, that is nasal therapy. Nasya involves administration of medicated oils or formulations through nasal route. It helps clear the head and neck channels, improves breathing, reduces sinus congestion, and alleviates symptoms such as headache, brain fog, impaired smell, and mental fatigue. Fifth one is Rakta Mokshan, that is blood letting therapy. In a selected and properly indicated cases, Rakta Mokshan may help reduce inflammatory manifestations and purify vitiated blood. It can be considered under expert supervision when inflammatory or vascular components are involved. Sixth one is Shirodhara. Shirodhara involves the continuous pouring of medicated liquids over the forehead. In liquids, it mostly involves tel dhara, quad dhara. This therapy has a calming effect on the nervous system and it's particularly useful for anxiety, stress, sleep disturbances, emotional instability, and cognitive fatigue, commonly observed after COVID. Now, below that, I have mentioned additional supportive measures for post-COVID symptoms. First one is Rasayan therapy. Rejuvenative medicines help restore vitality, improve immunity, and accelerate tissue repair. Second one is pranayam and breathing exercises. Techniques such as Anulom Vilom and Brahmari improve lung capacity, oxygenation, and mental relaxation. Third one is sattvic diet and hydration. A light, nourishing, easily digestible diet supports Agni and prevents further harm formation. Then fourth one is yoga and gentle physical activity. Gradual physical activity helps rebuild strength, flexibility, and stamina. Fifth one is adequate sleep and stress management. Proper rest is essential for immune recovery and mental well-being. Now, who can benefit from this? First is individuals experiencing lingering symptoms after COVID-19, patients with persistent fatigue and breathlessness, people suffering from recurrent infections and restlessness. Individuals on long-term medications requiring rejuvenation and detoxification. Elderly individuals who need support for vitality and recovery. The expected outcomes are improved energy levels and stamina, better respiratory function, enhanced immunity and resilience, improved sleep quality, better digestion and appetite, reduced stress and anxiety, improved mental clarity and concentration, and enhance overall quality of life. That's why Panchakarma is not just detoxification, it is a journey back to health, balance, and vitality. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Divyarani for the paper presentation.
Good evening, everyone. Myself, Dr. Divyarani, Associate Professor from Department of Samhita Siddhanta and Sanskrit, Yenappa Ayurvedic Medical College, Mangalore. Today, I am going to present on the topic Application of Gunas in the GIT disorders. Coming to the contents of my presentation, introduction, objectives, methodology, analysis of guna from Nidana to Arista Lakshanas, discussion, conclusion, and references. Introduction. As we all know, gastrointestinal disorders are prevalent globally, affecting digestion, metabolism, and overall health. Ayurveda offers a unique perspective of digestive health through a Guna Siddhanta. Ayurveda emphasizes the role of Nidana in the progression of the disease and Arishta Lakshanas as the indicators of disease severity. However, there is a lack of systematic exploration of how gunas influence the transition from Nidana to Arishta Lakshanas in a digestive disorders. So the present era needs to analyze how Guna Siddhanta can provide insights into the pathogenesis, prognosis, and the management of especially the digestive diseases. So, as we all know, the guna is derived from the guna amantrane, which means to invite. So, which attracts or invites towards a particular object is called as guna. Samavaito nischeschaha karanam gunaha. So, we all know the gunas are divided into Sharirika guna, Vishesha guna, Adhyatmika guna, and Paradi guna. So here Sharirika Guna as act like a Sharirika Nidana, like Ushna, Tikshna, Shita, etc. Vishesha Guna, that is the Indriyartha Guna, or again it will be called Sharirika Nidana also. Adhyatmika gunas like a manasika nidana, dukkha, dvesha, icha, everything we can consider to cause as a manasika disease. And here the paradi guna, main role in the chikitsa, as we know para, pesa, etc. will mainly helpful in the chikitsa part. So my objectives of the presentation are to analyze the role of Nidana in the manifestation and the progression of digestive disorders based on the Ayurvedic principles, to explore the relevance of Arishta Lakshana in digestive disorders, to identify severe and irreversible disease conditions, to apply Guna Siddhanta and to understand the pathophysiology of digestive disorders, including the transition from Nidana to Arishta Lakshana. So we know that some digestive disorders in the present era, like main famous is irritable bowel syndrome, IBS, gastritis, peptic ulcer, indigestion, bloating gas, abdominal pain, nausea, heartburn, and irregular bowel movements. These are the common day-to-day life we face, and many patients also we will see. So here in our classics, they have explained rogaha sarve api mande agno sutaram udaranit. So the every disease, mainly the agni is a main role. That is a manda agni. Shanto agni mriyate yuktem chiram jivatyamanayah. So here when agni is stopped, shanto agni, when agni is completely stopped its normal action, then there might be death also. So Shama Prakopa Doshanam Sarvesham Agni Samshritaha. So anything the disease Shamana or Prakopa, Dosha Shamana, Prakopa, etc. Everything is dependent on Agni itself. So Agni is a main important factor in the disease. So coming to the methodologies, a literature review I have compiled with the GI disorder with Ayurvedic dietary, lifestyle and herbal intervention based on the opposing gunas that we call as Viparita Guna Chikitsa principles. So here are some diseases and nidana and chikitsa based on the guna only. So amla pitta, gastritis, we know the causes are ushna, tikshna gunas. And same, the chikitsa will be shita gunas that include the drugs patola, nima, madana, vasa, honey, shatavari, esti, madhu, amalaki, etc. In the same way, the disease vibanda, constipation. Main causes are ruksha and khara gunas. So treatment will be opposite, that is snigdha therapies like mrudu virechana and sukumaragrata. So in the same way, many diseases are there admana, shita ruksha guna, that is ushna snigdha dietary modification, udara guna, ushna ruksha ahara, sigdha therapies like niyatya virechana, like that we will use, and grahani roga lagu tikshna and manda gunas will be there, and digestive treatment will be the herbs. Basmaka roga is there. It main causes are ushna and ruksha guna, and the chikitsa will be mainly adopted by guru snigdha guna. In the same way, atisara is a disease related to GIT. Drava and sara gunas are main, and chikitsa will be like drying and binding interventions. So here also our main doshas Vata Pitta Kapha will act on the gunas itself. So everyone know Vata Ruksha Chala guna is predominant. By that Anaha Vibandha will be caused and treatment will be Ushna Sigdha Guru. Pitta Ushna Tikshna guna will cause Amla Pitta Vida etc. and Shita Lagu is a treatment. Kapha Guru Pichila is a guna and Mandagni Ama will be the diseases and treatment will be like Lagu Ruksha Ushna. So these are the some daily day to day life aharas we can consume, and it is having the lagu shita gunas mainly needed for the GIT diseases like green gram is there, cucumber is there, and the shunti is there, goduma is there. So mainly these are the lagu and snigdha and the guru property. So it will be shaman, do the shaman of a GIT diseases. Same way, coming to the buttermilk is there, madhu is there, pomegranate. These all are contain mainly the pittara, agnivartaka, and the shita guna, lagu ahara, and all. So application of guna, how we can apply guna in our day-to-day life, even as a preventive and as a curative. So in the Charaka Sutra Sthana, 5th chapter only, it has told the importance of prevention of the disease. So Guru and Lagu Ahara Dravya. Ahara Matra is mainly depend on Agni. So how much Guru Ahara we have to take, how much Lagu Ahara we have to take, it is finely explained in the Charaka Sutra Sthana, 5th chapter. So again, it is the guna is important here. And also the treatment. Viparita gunai desha matra kalopapaditai. For example, if we don't know the any disease diagnosis or anything, we can analyze the guna or dosha. In that guna we have to see, and opposite to that guna we have to treat based on the desha. If it is in the anupadesha patient, and if by anupa aharas if is getting, then viparita guna jangala type of aushadis we can give, matra kala, everything we the opposite we have to give. So this is the in the Nidana Panchakas. I am analyzing how gunas is helpful. So for example, here Nidana Basmaka Roga, I have taken the example. For example, Swa Ushmana Pakasthane Balam Agne Prachati Tada Labda Labe Dehe Virukshe Sonila Analaha Taikshna Dashu Mohurmu. So here see the gunas which I marked in the red. So Ushmanam already Agni's Tikshna, Pitta Prakopa takes place, and Pakistana Vaiswa Agni will become excessive. And Viruksha Guna of Anila, it will also increase Agni, and Taikshna will increase, and Muhu, the frequent food we have to take, and it will get digest again. It's about a Bhasma Karoga. And what treatment we have to give? Guru, Snigdha, Shita, Vichala. Based on the gunas only, they have mentioned the Ahara. And Snigdha, Shlakshna, Sthirahara, Snigdahara, Pichita Ambuhara, Guru Bhojana. So mainly in Attagni, Nidana also Guna, and treatment also Guna. In the same continuation, the diagnosis gunas are important. Based on that, we have can diagnose treatment. As I told, viparita guna, and it can be included in the diet, lifestyle, herbal remedies also. And in the treatment, panchakarmas, mainly the amana virachana, we see the gunas. Then hetu linga aushada. Guna is again here important. So coming to the what I told Arishta Lakshana, progresses also we can assess. For example, Vikrita Varna told as a form of Arishta Lakshana. Harita, Pita, Tamra, Mutra, Shava, Varna, etc. Vikrita Varna caused in the serious patient that may lead to death is called as Arishta Lakshana. So here main Teja Rupa Sparshavati will tell Vayu Agni Tejo Dhatu Varnakara. So here mainly the Pitta will hamper that may lead to the color discoloration. So here entire Pitta Mahabhuta is having the Jala and Agni Mahabhuta, Ushna Guna, and again the Ranjaka Pitta is a main factor of the imparting color. So Guna also plays role in our changes in the color, changes in the sparsha related factors and all. So coming to the modern science, contemporary science, we will see the gastrointestinal tract diseases like Crohn's disease is there, chronic liver disease is there, IBS is there. Again, our guna, how we can interpret. For example, Siddha guna is there. It lubricates the GI tract. That is fatty liver, bile related disorders may come. Ruksha guna dries the intestinal lining and constipation and leaky gut may possible. Khara guna irritates mucosa, colitis and Crohn's disease may come. And Guru Pichila guna is there. It increases the mucus and like that pylori infection and IBS may form. So, coming to the conclusion, Guna Siddhanta provides a scientific and systematic approach to understanding the gastrointestinal disorder beyond the dosha theory alone. By mapping Guna imbalance to specific GI condition, Ayurveda can offer precise personalized intervention for digestive health. So, this study highlights the need for clinical validation of Guna based treatments and integration into the modern gastroenterology for holistic management. So, in the summary, understanding of the gunas involved dosha imbalances is crucial for Ayurvedic practitioner to identify the root cause treatment and decision making gastrointestinal disorders. These are the references. Thank you.
Thank you, Doctor. That was an excellent presentation. And thank you for sharing your insight with us. Thank you so much, Doctor. And next we go to the another paper presentation. I would like to invite Dr. Sakshi Dilip Devang for the paper presentation.
Good evening, everyone. Myself, Dr. Sakshi Devang. I'm MD scholar from the Department of PTSR. I'm from Institute PDA's College of Ayurveda and Research Center, Nigri, Pune. Name of my guide is Dr. Anjali Zadav, ma'am. She is HOD, Department of PTSR. Name of my today's topic is an Ayurvedic approach in the management of cervical erosion, a case study. Introduction. Cervical erosion is one of the commonest benign conditions of female genital tract in all age groups and one of the commonest findings on routine pelvic examination in the fertile age group. It is basically characterized by displacement of squamous epithelium with the columnar junction of the endocervix. It comes with symptoms like excessive vaginal white discharge, dyspareunia, contact bleeding, itching, backache, etc. Ayurvedic approach. While talking about Ayurvedic approach, cervical erosion is not directly correlated with any of the Ayurvedic diseases, but we can correlate it with Garbhashay Grivagat Vrana. In Garbhashay Grivagat Vrana, the Twak and Mars Dhatu of the Garbhashay Grivamukh are involved. It is caused due to abnormal consumption of ahar, vihar, and that can lead to infection and injury of the reproductive organs, especially the cervix, and hence it is called cervical erosion. In Garbhashay Grivagat Vranas, Pitta Kapha predominance is mostly seen in the pathology. So the treatment also requires the drugs that has properties of Pitta Kapha Hargana. Case report, I'm sharing this report that took place in our OPD. So there was one 48-year-old female patient with registration number of 25G340. She came to our College of Ayurveda Research Center and Snowbell Multispeciality Hospital in Sriro Gopidi on 2nd of January 2025. She had following complaints. She had pervaginal white discharge since 3 to 4 months, itching, pervaginal itching, pain during coitus, generalized weakness, and lower backache since 2 months. She had taken multiple medicines and a number of treatments but had no relief. She got temporary relief from the symptoms. And hence she wanted something Ayurvedic, so she approached in our OPD. So I took a detailed history. Her past medical history was patient had recurrent infections with vaginal discharge with itching. She had no history of DM, hypertension, bronchial asthma, or hypothyroidism. Her past surgical history was no any history of surgical illness also. Her menstrual history was 3 to 5 days with 28 to 30 day of cycle, regular, moderate, had pain on the very first day and then there was no pain. She had no contraceptive history. OBS history was G2P1L1A1 and her last delivery was full-term vaginal delivery 20 years back. So in general examination, it was found that she was belonging to Vata Pitta Prakriti and there was no any abnormal finding in the general and systemic examination. Her BP was 110/70, pulse was 72, weight was 51 kg, height was 158 centimeter. So I did some detailed examination like purse speculum and PV examination. On purse speculum examination, it was prominently found that both the lips of the cervix were eroded and a bright red inflamed cervix was seen along with foul smelling discharge which confirmed it as cervical erosion. Bimanual examination had no any abnormal findings. Her uterus was anteverted, anteflex, normal in size and mobility. Both the fornices were free. No any polyp or anything was seen. So some investigations were taken place like CBC, urine routine microscopy, all were within normal limits. Blood sugar level was in normal range. Pap smear was done because of the discharge and her age group was she was more than 45, but the pap smear was negative for any malignancy. So it was confirmed that it is a cervical erosion, and I wanted to do something that is both locally and orally. So therapeutic interventions were like locally, I had given Trifara Quattro Yoni Dhavan once a day for 7 days, followed by Haldi and Turti Pichu locally once a day for 7 days. So first Dhavan was done, and Dhavan was followed by Pichu Kalpana with 1 gram of Haldi and 1 gram of Turti, and then the pichu was removed after 3 hours. Orally, I had given Pushanuk Chuna 1 gram TDS, Chandraprabhavati 250 mg TDS, Bolbaddaras 250 mg TDS, probiotic sachet were given BD, Sukshma Trifara was given BD for 15 days. This is our first visit case paper. You can see the details. For Yoni Dhawan and Yoni Pichu, since they are some procedures. Consent is taken before that. So this is the consent paper and follow-up paper. On follow-up, she was for 15 days, she was given Pushanuk Chuna, Bolabadharas, Chandraprabhavati, probiotic sachet, and Sukshma Drifra. After 7 day and 14 day marked transformation was seen. On the 0th day, the white discharge was plus plus with erosion plus plus. On 7th day, white discharge reduced to almost 70% and cervical erosion color changed from bright red to light red. And on the 14th day, white discharge reduced to almost 100% and cervical erosion got 90% healed. I'll show the results in the next slide. Like, yes, these are the results. On day 1, the erosion was promptly seen with white discharge. On day 7, the bright red color turned to light red. On the day 14th, with completion of 7 days procedure and 14 days of the oral drugs, marked transformation was seen with cervical erosion was reduced to almost 100% and white vaginal discharge was almost 80-90% cured. So the conclusion in the case is, irrespective to the wealth of recent advances in diagnosis and treatment facilities, symptoms of cervical erosion form a major complaint of patients in the OPD. We can prevent the incidence of this disease by educating the women for improving their general health and personal hygiene. The Sthanik Chikitsa mentioned in all the Ayurvedic texts like Yoni Prakshalan, Yoni Pichu play a very important role in curing cervical erosion and other infections too. The Sthanik Chikitsa has no any side effects and it is very cost effective. Ifraquat was very effective in Vrana and it was helpful in combating the microbial infection as it has properties like Shodhan, Dropan, Sravhar and Vedna Shamak Rasayan properties. It is Tridosha Shamakaha, Kafapittahar based on Kashaya Ras Pradhanya. It is Sangrahi, Ropan, Lekhan, which helps in healing the Vrana. Turmeric is antimicrobial and anti-inflammatory, which helps in wound healing properties, and it plays a vital role in local infection control and tissue healing. Sphatic is Lechen's cremignum and is beneficial in infections and secretions. The topical application of the Pichu allows for targeted action, potentially enhancing the therapeutic outcomes by reducing discharge, relieving inflammation, and preventing recurrence. These are my references from which I had taken the drugs and the cases. Thank you.
Thank you, doctor. Thank you for the well explained presentation. And we go to the paper and poster presentation. I would like to invite Dr. Indrajeet Misal for the paper presentation.
Good evening, everyone. I am from Dr. D.Y. Patil College of Ayurveda Research Center, Pimpri, Pune. The topic for my paper presentation is attention deficient hyperactivity disorder and Ayurvedic review under the guidance of Dr. Sandeep Daberao, sir, a professor, Department of Kumavur. ADHD overview. Attention deficient hyperactive disorder is a neurobehavioral disorder diagnosed in children aged 6 to 12 years using DSM-5 criteria. It is characterized by persistent inattention, hyperactivity, and impulsivity. Global prevalence is 5 to 10% in India, and boys are 4 times more likely to be diagnosed than girls, and over 50% of child neurology referrals are related to ADHD. Core symptoms of ADHD: inattention, poor focus, careless mistakes, losing items, easily distracted, forgetfully in daily activities, hyperactivity and impulsivity, excessive movement, talkativeness, interrupting, acting without forethought. Additional symptoms include decreased appetite, sleep disturbances, motor tics, and emotional dysregulations. Ayurvedic perspective is related with Manas Dushti. ADHD is understood in Ayurveda as a disturbance in Manas Dushti, an imbalance of mental faculties. Its lakshanas align with Manas Vikaras, mental disorders involving impairment of the intellect, dhriti, cognition and restraint, and smriti, that is the memory. This side leads to impaired judgment and erratic behavior. The key causative factor is Indriya-Artha Samyog, disturbed interaction between the Indriyas and their objects. We can correlate ADHD with Unmad. Unmad is described as in Ayurvedic classic text as Manas Buddhi Samya Smriti Chetna. Symptoms include disorders of perception, disorganized speech, and erratic behavior, closely mirroring the ADHD symptom profile. Classical tests describe a spectrum of mental disarrangement under the Unmad that reflects varying degrees of cognitive and behavioral disturbances. Types of Unmad and causes. There are 5 types of Unmad: Vataj, Pittaj, Kafaj, Sanipataj, Agantuj. Causes: doshas, imbalances, disturbing manobostrotas, dietary factors, lifestyles include sensory indulgence, sleep deprivations, psychological, intense emotions, trauma, and external spiritual affiliations, adharma and abhichara. संप्राप्ति of उन्माद. हेतु सेवन, वात प्रकोप, अल्पसत्व, हृदय स्थान संश्रय, मनोव स्रोत दृष्टि, उन्माद and संप्राप्ति घटक. दोष, त्रिदोष, राजस and tamas, दुष्य, मन, अग्नि, जाठर अग्निमांद्य, स्त्रोत, मनोव स्त्रोतस, उद्भव स्थान, हृदय, अधिष्ठान, मन, इंद्रिय, बुद्धि, व्याधि विग्रह and मध्य. Ayurvedic correlations of ADHD symptoms are inattentions, that is related to the dhriti smriti, impulsivity, asuktikam, acting without forethought, hyperactivity, chesta vibransh, excessive restless movements, and unregulated speech. Vidharma vikaras, anavistit chitta, mood fluctuations, samritta brahma, memory disturbance, and chesta vibram, uncoordinated actions. Dosha analysis. Children naturally show kapha dominance, providing stability, calmness, and steady cognition as the baseline constitution in healthy development. ADHD presents aggravated vata, restlessness, inattention, and disturbed pitta, impulsivity, and irritability with deficient kapha stabilization. Treatment targets with Tarpak kapha, brain protection, Sadak pitta, mental clarity, and Pranvayu to restore diastoic memory, harmony. Ayurvedic management of ADHD. First of all, is a Satvajai Chikitsa. Regulate the child's daily diet, sleep schedule, balanced nutrition, rich and antioxidant and immunity boosters. Avoid excess oil and spice. Ensure proper hydration, Shiro Abhyanga, and foot massage with sesame oil. Use of cow's ghee and cod liver oil. Brain development. Structure daily routine and task handle one at a time. Medde Rasayanas. Shankapushpi sharpens intellect, act as a brain tonic. Brahmi improves cognition and memory. Jatamasi strengthens mental abilities. Pushmanda addresses pitta disorders, epilepsy, and mental disturbances. Ashwagandha supports brain pathways, exerts nootropic and effect. Mandukparni enhances cognition, calms erratic and mental activity. Panchakarma procedures that are helpful in ADHD, Abhyanga, Shiropichu, and Basti. These are the references for my paper. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. And one more poster presentation is there.
Topic of my poster presentation is gadget addiction in children and its management through Ayurveda. Introduction. Excessive use of gadgets has major concern among children. Prolonged exposure to smartphones, fast plays, lights, and tablets from tablets, televisions, and computers leads to physical, mental, behavioral, and social problems. Ayurveda offers an holistic approach to prevent and manage gadget addiction by strengthening body, mind, and senses through behavioral, psychological, and lifestyle interventions. The dosh dusha involvement in gadget addiction is asatma indriya artha samyog. Indulgence of unhealthy subjects of sensory organs causes sensory overload, attachment, craving, and loss of control, which eventually leads to anger, delusion, loss of memory, and destruction of intellect, followed by pradnaprat, misuse of intellect, self-control, and memory, that the driti and smriti, results in wrong decision-making and continuous harmful behavior. The dosh involvement is manas dosha. Predominance of Rajaguna and Tamaguna leads to restless impulsivity, ignorance, and lethargy and attachment. Vata controls the mind. Its ventilation causes lack of restraint, anxiety, and restlessness. Pitta dosha disturbance intellect, leading to irritability, anger, and frustration. Dushya, buddhi, manas, majja dhatu, and nervous tissue. Management of gadget addiction can basically do by assessing the screen time and behavior, educating child and parents, reducing use gradually, replace with healthy and creative activities, strengthening of mind, body, and senses, Ayurveda approach, counseling and psychological support. Cognitive behavioral therapy, most proven and non-pharmacological treatment, divided into 5 stages: pre-contemplation, breaking denial and creating awareness; contemplation, recognizing the need for change; preparation, making plan and setting goals; maintenance, practicing new behavior and reducing the relapse; termination, sustained control and prevention of relapse. Ayurveda interventions for gadget addiction. Sattvaja Chikitsa, psychotherapy, works on mind, control negative thoughts. Methods: Ashwasana, guidance, धर्मत्वक्य, ईशत्वसन्य, अद्भुत दर्शन, संतावना, प्रतिवंदन चिकित्सा, ध्येय and संकल्प धृति. Yoga therapy, यम, नियम, आसन, प्राणायाम, प्रत्याहार, धारणा, ध्यान, and samadhi. Improves concentration, self-control, and emotional balances, reduces stress, enhances brain function and white matter integrity, increases self-esteem and positive feelings. Achar Rasayan, follow do's and don'ts for a disciplined life, prevents a Sattva Indriyartha Samyog and Prajna Aprat, promotes good behavior, moral values, and social well-being. leads to long-term physical and mental health. Use of Medhya Rasayana, Ayurveda nootropics. Medhya Rasayana promote intellect, Dhriti and Smriti, improves Sadat, Pitta and Majja Dhatu, calms mind, reduces irritability, anger, stress and anxiety, cleanses Manobhava Srotas and balances Sattva, Raja and Tamagun. I conclude the poster by gadget addiction affects the growth, development, and future of children. Ayurveda provides safe, effective, and holistic interventions through Sattvaja Chikitsa, Yoga, Achar Rasayana, and Medhya Rasayana. These methods are cost effective, require minimal infrastructure, and can be adopted even by every family. Early preventions and timely management are essential to build healthy and balanced society. Thank you, sir.
Thank you, Doctor. Thank you for the well-structured paper and poster presentation. And thank you so much, Doctor. Next, I'd like to invite Dr. Sarikonda for Pavani for the paper presentation.
Good evening, everyone. Myself, Dr. Sarikonda Pavani, PG Scholar Fine Years from the Department of Rasashastra and Vaisheshya Kalpana from Dr. NRS Government Ayurvedic College, Vijayawada. To the topic I am going to present is Lasunadi Vati, Lavangadi Vati, and Vyoshadi Vati. Lasunadi Vati is taken from the reference Vaidya Jeevana Shayaroga Chikitsha, 13th chapter, and from the AFI volume 1. It contains ingredients like Lasuna, Jeeraka, Saindava Shuddhagandhaka, Shunti, Madesha, Pippali, equal parts, and Nimbus Parasa is taken quantity sufficient for Bhavana. Method of preparation, one part of Shuddha Lasuna is taken in a clean kalvayantra and triturated to kalka form. It is added with fine powders of remaining ingredients and triturated to obtain a homogeneous mixture. Later, this is subjected with Bhavana with Nimbus Parasa, and pills are made in the size of 1 to 2 rakti and stored in airtight container. Dose is 1 gram, Anupana is warm water. Indications are Visushika, Kasa, Swasa, dyspepsia, diarrhea, dyslipidemia, obesity, gastroenteritis, PCOD or PCOS, Arthavakshaya. Rasadi properties of Lasunadivati. These all ingredients of Lasunadivati mostly possess Kadurasa, Ushnavirya, and Kapha Vatagna properties. Lasunadivati in dyslipidemia, how does it act? Um, Due to sedentary lifestyle, Guru and Snigdha Ahara leads to improper digestion and metabolism. It leads to AMA formation. These AMA interferes with normal lipid metabolism, so it leads to metal dhatu vruddhi. That is lipid accumulation. That leads to channel blockage, srotoroda, and lipid deposition in the vessels. How does this Lasunadivati acts? It's ingredients like Lashuna and Trikatu stimulate Jatragni and Datvagni, so it reduces ama formation. So it is having Lashuna is having Lekana and Medohara properties, so it reduces accumulated Medadhatu and clears Shrotavaroda. Tikshna and Ushna drugs removes obstruction, improves circulation, Rasavaha and Medavaha Srotas. So it leads to lipid normalization. Lasunadipati does not act as a direct lipid lowering drugs like statin, but works at the root level, metabolic level. Agniyanama corrects pathogenesis subnati vikarana. Contraindications of Lasunadipati avoid in Pitta Prakriti individuals in excess. Is not advised in gastritis or ulcers. Use cautiously in pregnancy. Manufacturing companies are Dauber, Vaidyanath and Jendu. Research updates of Lasunadvati, a review of efficacy of Lasunadvati in the gastrointestinal disorders was done, an evaluation of efficacy of Lasunadvati on the management of Arthakshaya research was done on that. Next, Lavangadivati is taken from the reference Vaidya Jeevanam Kasa Swasa Chikitsha. It contains ingredients like Lavanga 1 part, Maricha 1 part, Vividaki 1 part, Kadrasara 3 parts, and Babula Kashaya quantity sufficient for Madhana. Dosage 1 gram, Anupana warm water, indication Kasa and Swasa. Other references are taken from Vaisheshya Ratnavali, Nimanja Rogadikara. It contains ingredients like Lavanga 1 part, Shunti 1 part, Maricha 1 part, Shuddha Rankana 1 part. Method of preparations, all the ingredients are taken in Kalvayantra and saturated to obtain homogeneous mixture. This mixture is subjected to 1-day titration, each with Apamarka Swarasa and Chitrakamula Swarasa, to roll pills of 500 mg. These pills will be smoky in color with Kadurasa and Rasayana Gandha. Dose is 1 gram twice or twice a day. Anupana is Vishnodaka. Lavangadipati 2, it is taken from reference Vaisheshya Ratnavali Agnimanja Rogadikara. It contains ingredients from Lavanga to Saindavalavana. We have to take one part. Shuddha Parada, Shuddha Gandhaka, Abraka Basma, Loha Basma, you have to take half part. Method of preparation is first kajali is prepared and remaining fine powders are added to it and triturated to obtain homogeneous mixture. This mixture is subjected to 1 bhavana with Nagavalli Swarasam. Dosage 1 pill, 375 mg, twice or thrice a day. Anupana Ushnodaka, indications of Grahani Roga, Amajina, painful Pravahika, Jvara, Kapasashula, Kushta, Amlapitta, vitiated Vata Dosha, and Mandagni. Manufacturing companies of Lavangadi or Dabar, Vaidjinath, Divya Pharmacy, Huma Ayurvedics, Bharadwaj Pharmaceutics, Sadhana Ayurvedics, and Pharma Heads. Are the properties of Lavanga. Lavanga contains main trikatu तान कटु रस लघु स्निग्ध तीक्ष्ण गुण शीतवीर्य and katu vipaka kafagna and pitagna doshagna properties are there. Malaysia is having katu tikta lagu tikshna ushna virya and katu vipaka, mostly kafa vata kafa shamaka properties, and vibhitiki is having kashaya rasa lagu ruksha guna ushna virya madhur vipaka and tridoshahara properties. Next, Kadra is having Kashaya Tikta, Lagu Ruksha Guna, Sita Virya, Katu Vipaka, and Kapha Pitakna properties. And Babula is having Kashaya, Guru Ruksha Guna, Sita Virya, Katu Vipaka, and Kafagna properties. Discussion based on the analysis of Rasa, Guna, Virya, Vipaka, and Doshagnata, Lavangadi plays a significant role in Samrapti Bhagna of Kasa. The predominance of Katu, Tikta, and Kashaya Rasas contribute to Kapha Shamana, Sleshma Shoshana, and Strota Shodhana, thereby revealing obstruction in Pranamaha Strotas, which is a key factor in pathogenesis of Kasa. These rasas also enhance Deepana and Pachana, helping to correct Agnemandya, an important underlying cause in Kapha dominant respiratory disorders. The combined action of Lavanga ingredients provide a multi-targeted approach to relieving cough. Lavanga soothes throat irritation and reduces cough reflex through its local anesthetic and anti-inflammatory effects. Maricha acts as mucolytic and cough-reducing agent, facilitating expectoration and clearing phlegm. Kadira and Babula contribute astringent and anti-inflammatory properties, controlling mucus secretion, reducing throat inflammation, and protecting mucosal tissues. Vipatiki adds antioxidant, demulgent, and antimicrobial activity, further elevating irritation and supporting productive cough clearance. Collectively, these herbs act synergistically to soothe the respiratory tract, reduce inflammation, liquefy mucus, and control microbial load, providing rapid and effective relief from cough, as described in Ayurvedic classics. Research updates, iterative review on Lavangadi was done, and standardization of Lavangadi, a HPCLC approach was done on research on this, and evaluation of antibacterial activity of Lavangadi and its modified suspension form with HPTLC fingerprinting was done. Next, Vyoshadi. Vyoshadi is a formulation in the tablet form or in granules where Vyoshadi is the main ingredient. The medication is named after the main ingredient. Pikatu. The Vati is also called as Vyoshadi Vadakam or Vyoshadi Gulika. It is taken from the reference Saranga Madhyamakanda, 7th chapter. It contains ingredients Sunti, Maricha, Pippali, Amla Vaitasa, Shavya, Thalesapatra, Chitraka, Jiraka, Tindidaka, 12 grams each. And Twakela Patra, it is taken 9 grams each. And Guda is taken 240 grams. Other reference is from Ashtanga Hrudya, Nasaroga, Pratisheda. Method of preparation, the drug from 1 to 12 are taken in specific quantities in the clean kalvayantra, triturated to obtain homogeneous mixture. Later, the specific quantity of jagara is taken in a clean wide mouth to stainless vessel, placed over mild fire. It is added with required quantity of water and cooked with frequent stirring. When Gudupaka Lakshanas are attained, the fine powders of all the drugs are added little by little and stirred well to obtain homogeneous drug mass. Doses taken 3 to 6 grams. Hanupana is Madhu or Ushnachala can be taken. Next indications, Pinasa Roga, Swasa Roga, Kasa Roga, all types of Pratikshaya useful in treating acute and chronic rhinitis and asthma. It is improves and modulates voice. Prasadi properties of Vyoshadi is mostly all ingredients having Kadurasa and Ushnavirya and Kapha Vatahara properties. The mode of action of Vyoshadi major ingredients Rikatu, which is Katurasa Pradhana, Ushnavirya, Lekane in properties with balance at both Vata and Kapha doshas. All the ingredients are Ruchya, Deepana, and Pachana. The drugs are mainly Vata Kaphara in nature and indicated in most of Pranavaha Vikara, hence widely used in respiratory illness. Research updates the role of Vyoshadi in management of Pratisha in the children Western and to study the effect of Vyoshadi on Medha Vruddhi dyslipidemia with special reference to lipid profile was done research on this. If you see the comparative table of these Lasunadi, Lavangadi, and Vyoshadi, Lasuna main ingredient Lasuna and Rika 2, Lavanga is having Lavanga main ingredient, Vyoshadi Rika 2 plus main ingredient. Primary action of Lasunadi is Lekana and Lavangadi is Kapahara, Shotahara, and Kribigna. Vyoshadi is strong Deepana, Pachana, Kafavatahara. Lasunadi main dosha target is Kapha and Vata. Lavangadi is mainly Kapha and Vyoshadi is Kapavata. Systemic action of Lasunadi metabolic and systemic. Lavangadi is local plus respiratory. Vyoshadi is digestive plus respiratory. Special property of Lasunadi is Medohara. Lavangadi is shooting plus antimicrobial. Vyoshadi is Agnidipana. Main indication of Lasunadi is listomia, Ajina, Gulma, and Agnimanya. Lavangadi is Kasa, Kantaroga, and Mukaroga. Vyoshadi is Kasa, Swasa, Ajina, and Ama disorders. Conclusion: Lasunadi, Vyoshadi, and Lavangadi are classical Ayurvedic formulations that primarily act on Agnimandya and Kapha-related pathologies through Deepana, Pachana, and Srota Shodhana mechanism. Lasunadi demonstrates significant Medohara and Lekana effects, making it effective in metabolic disorders like lipidemia. Vyoshadi enhances Agni and respiratory function, playing a key role in Kasa, Swasa, and Ama-related conditions. Lavangadi provides localized relief in Kasa and Kantaroga with its Kafahara, Shotahara, and antimicrobial properties. Thank you.
Thank you, Doctor. Thank you for the valuable and informative presentation. And next we go to the another paper presentation. I would like to invite Dr. Pallavi Jagannath Bawale for the paper presentation.
Here I am, the Dr. Pallavi Jagannath Bawale. I am presenting the topic concept of immunomodulation and its role in preventing in pediatrics. Introduction. Every parent is desirous of longevity and the healthy life of the child. Health is the level of function or the metabolic efficacy of the living organism. In human, it is the ability of the individual or the communities to adapt and self-manage when facing the physical and mental social challenges. According to the WHO, health is a state of complete physical, mental, and social well-being and not merely absence of the disease or the infirmity. Health is also defined as balanced condition of the living organism in which the integral harmonies performance of the vital functions tends to the preservation of the organism and the normal development of the individual. A strong well functioning immune system is the constant of health, good health. The immunity is the balanced state of having adequate biological defenses to fight infection, disease, or the unwanted biological invasion while having the tolerance to avoid allergy and autoimmune diseases. The growth and development. Basically there is a difference, a slight difference between the growth and development. Growth is the measure of physical maturation, signifies an increase in the size of the body and its various organs. And growth is mainly due to the multiplication of the cells and increase in intercellular substances. The development is the measure of functional or physiological maturation and myelination of the nervous system. It signifies accomplishment of mental, emotional, and social abilities. The nutrition plays an important role in both growth and the development, and also for establishment and maintenance of the healthy immune system. The protein calorie malnutrition deficiency of micronutrient robs the body of its defensive capabilities, depleting while the blood cells as well as crucial immune system proteins. So, immunomodulation. The concept of immunomodulation has been gaining much significance worldwide as the people started realizing the uh, indispensable role of the immune system in maintaining a disease-free state. In the last 2 decades, to further the complicate matters, there has been a upsurge in the number of the strains of the infectious agent that no longer succumb to antibiotics has been observed. It is apparently clear that antibiotics have lost their magic touch after decades of the incursion prescription, improper use, and inevitable spread of bacterial genes that confirm drug resistance. The control of the disease by the immunological means has two objectives: the development of immunity and the prevention of undesired immune reactions. Uh, in clinical perspective, immunomodulators can be classified into three categories. Immunoadjuvants. Uh, an immunoadjuvant is an agent stimulates the immune system, increasing response to the pharma innovational journal vaccine while not having any specific antigen. Adjuvant perform one or more of the three main functions. First one, they provide a depot for the slow release of antigen, facilitate targeting of the antigen to the immune cells, and enhance the phagocytosis, modulate and enhance the type of immune response induced by the antigen alone. The immunostimulant, these agents are envisaged to enhance body's resistance against the infections, can act through both the innate and adaptive arms of the immune response. In healthy individuals, the immunostimulants are expected to serve as the prophylactic agents, such as the immune uh, potentials by the enhancing the basic level of the immune response, and in the individuals with the immune compromised conditions and immunotherapeutic agents. Immunosuppressants. These agents could be used for control of the pathological immune response in autoimmune disease, graft injection, rejections, graft versus host disease, hypersensitivity, and immune pathology associated with the infections. The Ayurvedic concept of the immunomodulators. Immunomodulators are considered now as one of the most potent tools in the management of the health and disease by modern medicine. The basic concept of immunomodulation not only exists in Ayurveda, but it being really practiced by the Ayurvedists for the centuries. In Ayurvedic practice, the objective of the immune enhancement is achieved through the use of the rasayana, lehana, ojovradha remedies. The Vedic Shamatva has much wider implication than the term immunity. The Charak has also described Bala as the factor that destroys the doshas or the disease causing factors that are the Balam, Dosharam, Nigradya, Doshanam. The Bala is used as a synonyms for the prana and ojas. They have the underlying meaning of the biostrength and the vitally with the natural resistance against disease. Rasayana. Apparently, Rasayana means an improved state of the nourishment, which in turn upholds increased immunity and youthfulness. And Rasayana can be drug, diet, or even a lifestyle that and conduct. The Rasayana are supposed to strengthen Oja and Bala, that is, biostrength with the natural resistance against aging and disease. It is stated to contribute to the integrity of the body tissues and thus increase the longevity. The other benefit of this therapy are from promotion of the memory and the intelligence, that preservation of youth, leisure, and complexion and the voice. The Rasayana measures act by one of the following three ways: acting at the level of the rasa, thus the directly improving the quality of the nutrition, acting at the level of agni, that is by improving the digestion and the metabolism of the body, and thereby affording the better nutrition, acting on the level of the srotas, that is by improving the microcirculation. It ensures the proper perfusion and the nourishment to the tissues, which provides the body's immunity against the degeneration or disease. A discussion. Ayurveda describes a number of the drugs as a rasayana and Ayurveda, which are claimed to possess the immunomodulatory effects. Some of the rasayanas which have possesses the immunomodulatory effect are the Ashwagandha, Amalaki, mm, Tulsi, Guruchi, Pippali, Punarnava, Yashtimadhu, Brahmi, Gold, of which the Guruchi, Tulsi, and Brahmi have been extensively studied. The Bringaraj have free oxygen radicals, scavenger mechanisms. The active principle of the Guruchi have been found to possess anti-complementary and the immunostimulating activities. The Eshtimadhu, other important Rasayan drug, has been found to the immunostimulating, which accelerates the lymphocytic transformation activation of the macrophages and increase the leukocyte count. It also have the anti-allergic, anti-inflammatory, and antioxidant activities. The clinical study with a combination of the Rasayana drugs, the Amlaki, Vidanga, Tibala, have shown an increase in immunoglobulin levels in infants, which is significant greater than that of the multivitamins used cases. A combination of four important Rasayana drugs, that Guruchi, Ashwagandha, Amlaki, and Tulsi is equal amounts was found to potentiate both the cellular and humoral components of the immunity. The conclusion, Ayurvedic drugs potentiate the immune system, that is the Vedic Shamatva, decrease the morbidity and improves the growth and development of the children. To conclude, the Ayurvedic immunomodulators are effective growth and development enhancers and considered now as one of the most potent tools. And I have made this presentation from this using these references. Thank you so much, Nirmaya.
Thank you, doctor. And one more poster presentation is there.
I am presenting this poster under the title Pediatric Nutrition. Here, I only added this the tagline is the healthy eating today builds a stronger, happier tomorrow. Uh, Nourish today, thrive tomorrow. There is a good nutrition is very needful in the pediatrics. Good nutrition in childhood is the foundation for the growth, development, learning, and a healthy future. Here I shown a plate of the full nutrients. Here in this corner contains the fruits and vegetables, which should be rich in vitamins, minerals, and fiber. Eat a variety of colors in every day. Then it should be full of the proteins, which helps for builds and repairs the body tissues, which includes the plants or the animal sources. Then your whole grain should be added to the uh, full plate for the children, which provides the energy and the fiber. Mostly choose the whole grains and more. Then should drink the plenty of water and it should be clean. Then the next corner, healthy habits for the healthy kids. Uh, Eat meals together as a family. Choose fresh, minimally processed food. Limit sugary drink, junk food, and excessive screen time. Mm, Encourage the regular physical activities. Get enough sleep. Then good nutrition helps in children grow well, which supports healthy height and weight, learn better, which nourishes the brain and for focus, memory, and learning. Should stay strong, boosts immunity, and helps to fight the illness. Stay active, provides the energy for play, sports, and daily activities. Feels good, promotes good mood and healthy habits which are possible this good nutrition. Thank you so much.
Thank you for the valuable paper and poster presentation. And thank you so much, doctor.
Thank you, Nirmaya.
Okay, next we go to the another paper presentation. I would like to invite Dr. Akhila Avdani for the paper presentation.
Namaste, myself Dr. Akhira Avadhani, first year PG scholar from the Department of Kaumara Bhritya, Sri Sri College of Ayurvedic Science and Research, Bengaluru. This presentation is guided by Dr. Sharvati Deshpande, Associate Professor, Dr. Sudhir BR, HOD of the Department of Kaumara Bhritya, Sri Sri College of Ayurvedic Science and Research, Bengaluru. These are my contents. Introduction. Navajata Shishu Paricharya. comprises of all the measures that includes in taking care of a newborn. Tata saklesha vihitan pranan punarlabhet. So those which measures which takes out the klesha and returns the prana. But why do we need this? The activity of pranavayu in fetus that was dependent on the mother needs to establish itself independently. There is the need for the establishment of independent cardiorespiratory functioning. WHO and NRP, that is Neonatal Resuscitation Program, emphasize warmth, airway establishment, stimulation, and early breastfeeding, which majorly align with that of the Ayurvedic neonatal protocols. What is the difference between Pratyagamana versus Pratyanayana? विक्षिप्तः पुनरिव मरणम् अनुभवतो लीयमानं संज्ञस्य अतिसंबाधयो Niputava Pidita Prana Pratyanayana. This is told by Vagbhata in Ashtanga Sangraha. Prana Pratyagamana. Agamana means to return or coming back. Implies restoration of prana after its departure. Suggests revival of a state where vital functions are absent. Prana Pratyanayana. Anayana to bring forth. That implies facilitation or initiation of prana, indicates establishment of vital functions in a newborn. Why do we need this establishment or these protocols for this? Because we see that the baby cries soon after birth, which tells us that the baby's cardiorespiratory functioning has been established independently. Why doesn't the baby cry? Sushruta Acharya has told that Jarayuna Mukhe cha anne Channe Kanthe cha kafavishtite Vayumarge nirodha cha garbhastaha na prarodati. The garbha does not do rodana due to mukha being covered with jarayu, kafaveshtana in Kantha Pradesha, and Vayumarga nirodha. So we have to give enough stimulus for these kind of things so that the baby cries and independently establishes its cardiorespiratory functioning. So what are the Purva Karma? We all know that the pregnant women in those days were taken to the Sutika Gara where Agnisthana was present. So this serves two purposes, thermal regulation and aseptic precautions. Agni, which is lit before the delivery itself, was helping in regulating the temperature of the entire room. In present day also, we used pre-warmed clothes and temperature regulation of the room. Aseptic precautions. The Agni lit before reduces the germs and microbes in the surrounding environment. Even today, we do the fumigation of the room and use sterile instruments. Clinical resuscitation and integration pathway. Prana Pratyanayana by tactile and auditory stimulation. Airway patency, Mukha Vishodhana, clearing the secretional blocks from throat and nostrils. Thermoregulation by preservation of vernix gaseosa and Pichudharana. Sterile cord cutting, Nabhinala Chedana, that is the measured cutting combined with sterile aseptic clamping. Daiva Vyapashraya Chikitsa, Mantropachara, that is chanting, and Raksha Karma for neurological stabilization. We will look into some of the steps and its effects. Shitodaka, Ushnodaka, Mukha Parisheka. Sprinkling of Shita and Ushna Jala alternatively over face. This does the stimulation of Sparshanendriya. As we know, Sparshanendriya is the skin and it is a Vata sthana and thereby stimulates the Vata. So the touch and temperature receptors present over the face gets stimulated. The trigeminal nerve which runs over face and head gets stimulated and thereby stimulation does of the respiratory center which is present in medulla. Ashmano Sanghatana, generation of Karkasha Shabda, harsh sound near the ear of the newborn. Shrotrendriya Udbodhana, Indriya Prabodhana, stimulation of prana and vata hence occurs. That is the auditory stimulation. Nishpunana with Krishna Kapalika Surpa. Repeated fanning using Krishna Kapala Surpa. Why Krishna Kapala Surpa? Krishna is black, so hence absorbs heat and provides warm air. Kapala, that is the broken earthen pot, which is porous in nature, collects more air. Surpa, due to its concavity, traps more air, so helps in prana udipana, that is increased O2 oxygen supplementation, facilitation of spontaneous respiration. Ulba Vishodhana, removal of excess ulba adhering to mukha, nasa, and sharira using ghrita and saindava. Grita, being the bad conductor of heat, traps the warmth. Saindhava, having Sukshma Guna, does Ulbha Vigatana, Kafa Avarana Nivritti, and Sroto Shodhana. These measures help in hypothermia and acts as a skin barrier with microbiome benefits. Pichu Dharana. Placement of Sneha soaked Pichu over Murdha for the protection of Brahmarandra, Vata Samrakshana, and also reduces the Prasuti Klesha. Protection of anterior fontanelle to prevent hypothermia and dehydration. Balataila Sechana, application of Balataila over the body. Vatashamana, Balavardhana, Sparshanendriya Udbodhana. The percutaneous and transcutaneous absorption is increased as the newborn epidermis is thinner, hence increases the nutrition. Nabhinala Chedana, cutting of Nabhinala using Ardhadhara Shastra or Tiryakdhara Shastra at 4 or 8 angulas above. Aseptic measures while cutting the umbilical cord and tying it loosely over neck to prevent contamination from urine and fecal matter and to prevent neonatal tetanus. Garbhodaka Vamana, inducing Vamana using Saindhava, Ghrita, and Vacha. Vacha being Deepana, Pachana, and Vamanopaga, and Saindhava does the Kapha Vigatana and removes excess Garbhambu. So, removes the aspirated amniotic fluid or the muconium contaminated amniotic fluid, hence cleans the gastrointestinal tract. Mantropachara, it is a unique procedure explained in Ayurveda. The father of the child tells in the ears of the newborn, Angat Anga Sambhavasi, Hridayadapi Jayase, Atma Vai Putranamasi, Sajiva Sharadam Shatam. Shatayushatavarshosि Dirgamayuravapnuhi Nakshatrani Dishoraptre Ahashchavibhirakshatu Abhirakshatu. The acoustic vibration of the father's voice chanting sacred verses near the ear of the newly born child stabilizes the infant's subtle energy, establishing powerful neuropsychological protection after birth trauma. The shloka has been taken from Ashtanga. What are the effects? We know in our we give importance to Daiva Vyapashraya Chikitsa, that is spiritual recovery, Sattva Chikitsa, cognitive balancing, and this reassures the baby and also acts as psychic shield and promotes the Dirgayu of the child. Madhukrita Prashana. It is a traditional practice described in Jatakarma. Pinch of ghee and honey mixed together is given to the newborn. This is the practice of administering Vidruddha Ahara in very minimal quantity soon after birth, hence which activates the immune system of the child. This prevents hypoglycemia, helps in assessing rooting and sucking reflex of the baby, to promote medha and enhance smriti, promote immunity and vitality, and supports digestion and metabolism. Critical appraisal. What are our strengths? Emphasizes on immediate neonatal care, focus on airway and respiration, physiological basis for sensory stimulation. Our limitations are limited scientific validation, need for standardization and research. Future scope, experimental evaluation of classical procedures, integration with modern neonatal care, validation of procedures such as Ashmano Sanghatana, evidence-based interpretation of Ayurvedic Prana Pratyanayana. Take home message: modern neonatal resuscitation saves lives in emergencies, while Ayurvedic neonatal care supports the newborn's physiological adaptation, growth, and well being. Together, they promote a holistic approach to neonatal health. These are my references. Thank you.
Thank you, Doctor. Thank you for the well expressed and wonderful presentation. Thank you so much, Doctor.
Thank you, sir.
And next, we go to the another paper presentation. I'd like to invite Dr. R. Haripriya for the paper presentation.
Good evening, one and all. Myself, Dr. R. Haripriya, final year PG scholar from Dr. NRS Government Ayurvedic College, Vijayawada. Today, I am going to present a topic regarding cultivation practices of Ashwagandha, Satawari, and Pippali. Generally, medicinal plants are valuable natural resources widely used in Ayurveda.
Due to increasing demand and depletion of wild populations, cultivation of medicinal plants has become essential for ensuring a sustainable supply of quality raw materials. Cultivation helps conserve biodiversity, maintain drug quality, and support the growing needs of pharmaceutical industry. Important medicinal plants such as Ashwagandha, Satawari, and Pippali are now increasingly cultivated to meet commercial demand and reduce pressure on natural habitats. So for this, the requirements are soil requirement, agro-weather conditions, land preparation, seeding and planting, natural biopesticides, irrigation requirements, harvesting and post-harvesting techniques. First, we will see Ashwagandha. The soil requirement is mild, red or black soil needed. Agro-weather condition highly tolerant to 20 to 38 degrees Celsius. Land preparation, the soil should be pulverized. For preparation of the soil with the combination of 50% soil plus 20% peat moss plus 30% vermicompost. The seeding and planting techniques like seeding, sow in 1 to 3 centimeters deep. Distance between plant to plant should be 8 to 10 centimeters. Distance between line to line should be 20 to 25 centimeters. Natural biopesticides are organic manures, that is FYM. Farmyard manure, that is prepared by collecting and decomposing a mixture of animal dung, urine, and farm waste. Natural, to prevent the diseases, natural biopesticides are neem, cow's urine. Apart from that, buttermilk spray for fungal diseases, garlic and chili extract. All these are natural biopesticides. Irrigation, usually it is a rain-fed crop. First irrigation after the seed germination, that is 1 month, 30 to 35 days. Second irrigation is after the 2 months, that is 60 to 70 days. Harvesting after 150 to 180 days, that is 5 to 6 months. When leaves become dry, berries turn red to orange, the roots yield around 300 to 500 kg per hectare when dried. The post-harvesting, the higher the length of the root pieces, the higher will be the market price. Second, Shatavari cultivation. The soil requirement is like Shatavari grows in variety of soils, especially in medium black soil. The agro-weather condition easily grown in subtropical or sub-temperature regions. The land preparation requires deep ploughing. Seeding and planting, Shatavari is cultivated in seed as well as vegetative propagation through seeds sown in April is in raised beds at 5 centimeters apart. The germination starts in 8 to 10 days after the shower of monsoon in June. Again, for vegetative propagation, the division of the rhizomatous discs, these are planted covering the buds and followed by irrigation. Here also the same natural biopesticides, organic manures, that is FIM, farmyard manure, vermicompost to prevent the diseases, neem, cow's urine, buttermilk for fungal diseases we can use. Irrigation after rainy season is over. Harvested after 40 months, that is around 3.5 years. In winter season, roots dug out, collected and cleared, cut transversely into pieces and dry in shade. Post-harvesting, per plant 2.6 kgs per plant after 40 months we will get. Precautions, as the rodents will occasionally eat the tender roots, so we have to take care of the roots. Pippali cultivation, the soil required is like it is grown in variety of soils. Agro-weather condition needed are usually grows in the rainfall areas as it requires high humidity and frequent irrigation. The land preparation requires 2 to 3 ploughing. Seed and planting, vegetative propagation of Pippali is by root vine cuttings. The rooting takes place 50 to 20 days after plantation. The time of plantation is onset of the monsoon, that is around May to June, 60 to 60 centimeters spacing between row and row and plant to plant. For natural biopesticides, application of 0.25% neem seed kernel extract as a spray or any other neem-based insecticide is effective to control the mealybugs which are easily affect the Pippali. Irrigation ensures during summer, or irrigation once or twice per week depending on the soil moisture we have to irrigate. Harvesting, vine starts fruiting 6 months after planting. A fully grown mature spike should be harvested before ripening. Mature spike, which is when they are blackish green and still hard before they fully ripen or turn red, are harvested. After the third year, yield declines. Then the thicker roots are collected. Post harvesting, on an average, the yield is 500 kgs roots only per hectare. Dry the harvested spikes stored in a moisture proof container, should not store more than a year. So from this, we had the need of cultivation of the medicinal plants such as Ashwagandha, Satawari and Pippali is like increasing demand for Ayurvedic pharmaceutical industries. Conservation of wild population and prevention of over-exploitation ensures quality and purity of the drugs, uniform phytochemical content and better standardization. The higher the economic returns to the farmers, protection of endangered and vulnerable species from extinction. By cultivating sustainable supply throughout the year will be there. Thank you.
Thank you for the well-explained presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. M.S. Srigar Sai for the paper presentation.
Good evening, everyone. Myself, Dr. M.S. Srigar Sai, final year PG scholar, Department of Kaya Chikitsa from Dr. NRS Government Ayurvedic Medical College. My presentation topic is an Ayurvedic approach in the management of Mootrashmari, which can become correlated to urolithiasis, a case series. Contents: introduction, patient details, history, Chikitsa, discussion. Introduction. The word Ashmari derived from the Dhatu Ashma, meaning stone. The word Ari refers to enemy. It is one among the Ashtamahagada as explained by Acharya Sushruta. Acharya Charaka explains it under Basti Marmashrita Vyadi. Mootrashmari is a Kapha Pradhana Tridoshaja Vyadi. In modern, it can be compared to urolithiasis. Urolithiasis is defined as solid concretions formed in a kidney or urinary tract due to the precipitation of salts in supersaturated urine. This first case report, patient is a female aged 35 years, working in Vijayawada, came to our hospital with complaints of low backache, dragging pain radiating from groin to loin, burning associated with burning micturition. On examination, patient is having right iliac pain and right renal angle pain. Rogi Pariksha, Ashtasthana Pariksha, Nadi, Vatakapha, Mala 2 times per day, Mutra, no obstructive flow, but patient is having burning micturition. On examination of Jihva, the patient Jihva is Liptata, Ramayukta, Shabda of a patient is Prakruta, Sparsha is Anushna Shita, Druk is Prakruta, Akruti is Madhyama. Second case report, a male patient aged 50 years working in Vijayawada came to our hospital with present complaints like low backache since 1 year, dragging pain from groin to loin, associated with obstructed urine flow. On examination, this patient also having right iliac pain and right renal pain. This patient is also having same Nadi, Vata, Kapha and all other remaining symptoms. On Roga Pariksha, we came to know Nidana is Asamyak Shodhana, that is Vegadharana. Either it may be the Mala or Mutra Vegadharana. The patient is having Malabaddhata. Due to his stressful life and work, he is unable to drink a proper amount of water. Along with his diet is Kapha Mutra Prasakta Ahara. And Lakshanas are like Katishula, Basti Pradesha Shula, dragging pain from loin, groin to loin, Mutra Daha. Samprapti, due to Vegadharana, Apatyahara, there is a Vata Prakopa and Vimarga Gamana of Vata into the Basti, which is leading to the Shoshana of Mutra, which is present in the Basti. The minerals in the Mutra get solidified and leads to the formation of Ashmari. Chikitsa treatment protocol followed for 2 patients are Kanchanar Gugulu, Swadamshradik Vata, Chandra Prabhavati and Avipattikara Chodna. Kanchanar Gugulu with 500 mg BD along with the Trunapanchamulak Vata, Swadamshradik Vata administered along with Avakshara and Anupana for this Swadamshradik Vata is Ushna Jala, Chandra Prabhavati 250 mg BD with Ushna Jala, Avipattikara Chodna 10 gram OD bedtime with Takram. These are the USG reports of a first patient before and after treatment. Before treatment, patient is having multiple renal calculi of size 3 to 5 mm in both right and left kidney. After the treatment, no calculus is found in both right and left kidney. These are the second patient USG reports. Before treatment, the patient is having 30 mm calculi in right kidney. After treatment, it has been reduced to 18 mm in size. Discussion. Patient has undergone medical management and symptoms of groin to loin pain has relieved within 2 weeks of regular medication and following of Pathya. Patient reported in complete relief of burning micturition within 1 week of medicine intake. Although Mutrashmari is considered as Ashtamahagada according to Sushruta, a recent approach with prescribed line of management and following Pathya is proved doing wonders in patient care. Patya advised for patient Ahara like cereals, Puranashali, Raktashali, and Goduma. Yavar advised pulses like Kulatta, Muddar advised. Jalapana is advised along with Takrapana. Vegetables like Pushmanda, Pashana Beda, and Tumbi are advised. Viharas like regular voiding of urine, regular physical activities advised for this patient. The things that should be avoided are considered as patya, apatya, aharas like alpa jalapana, ati lavan yukta ahara sevana, ati sevana of chocolate, spinach, sweet potato, animal protein, almond, cashew, dairy products, vitamin C contents are advised to avoid. Vihara like ati vyayama, vegadharana are avoided. Thank you.
Thank you, doctor. Thank you for the energetic presentation. Next, we go to the another paper presentation. I would like to invite Dr. Deepika for the paper presentation.
Good evening. Myself, Dr. Deepika, PG scholar in the Department of Kaya Chikitsa from Dr. NRS Government Ayurvedic College. Today, my presentation topic is an Ayurvedic approach in the management of Vypatika, a case study. Contents, introduction, patient details, history, and discussion. The skin is the major organ being exposed to external environmental agents like physical, chemical, and biological agents. The skin protects from microbes, regulates body temperature, and perceives sensation of touch, heat, and cold. Skin has 3 layers. The epidermis, being the outermost layer of skin, provides a waterproof barrier and creates skin tone. The dermis beneath the epidermis contains tough connective tissue, hair follicles, and sweat glands, and the deeper subcutaneous tissue, the hypodermis, is made up of fat and connective tissue. In Ayurveda, it can be correlated with Vaipadika Kushta. The word Vaipadika is derived from 2 words. Vai, Vyayati means to become weary or exhausted or to be deprived of. Pad meaning Pada. Vaipadika afflicted with lesions on the palms and soles. It is included under Kshudra Kushta with Vata Kafaja dosha involvement and is characterized by Pani Pada Sputana, which means fissures in palms and soles, and with Tivra Vedana, severe pain. According to Acharya Charaka, the Lakshanas include Pani Sputana, Pada Sputana, Tivra Vedana, and according to Acharya Vagbhata, Pani Dari, which means cracks or fissures on palms, Pada Dari, cracks or fissures in soles, Tivra Arti, which means severe pain, Manda Kandu, slight itching, Raga, colored granules, and other lakshanas of Vaipadika. According to Acharya Sushruta, Kandu, Daha, and Vedana over Pada are the lakshanas of Vaipadika. According to modern science, Vaipadika is correlated with palmoplantar psoriasis, which is a chronic skin disease mainly affecting palm and sole regions. Palmoplantar psoriasis is a variant of psoriasis that characteristically affects the skin of palms and soles. It is caused by a combination of genetic and environmental factors. The most common genetic factor associated with palmoplantar psoriasis includes the human leukocyte antigen, which is HLA-CW6. On physical examination, thick hyperkeratosis plaques are the most common subtype. Symmetrically distributed lesions are common, as well as erythema, fissuring, and scaling. Patient details. Patient named age 34, gender female, who is working in Vijayawada with OPD number 32565. Presenting complaints. Patient presented with complaints of severe pain and burning sensation of bilateral soles of feet since 6 months, associated with itching, which is aggravating at night. On examination, we found out there are rough patchy skin surfaces with elevated skin margins, pada suptata, numbness, marked hyperkeratosis, and fissures and cracks on skin. Ashtisthana Pariksha, Nadi Vatakafa, Mutra is Prakrita, Mala is constipated, that is Vibandha, Jihva, Amayukta, she's having coated tongue, Shabda Prakrita, Sparsha is Karasparsha, giving a rough patchy skin, Drik is Prakrita, and Akriti is Madhyam. Nidana, Viruddhahara Sevana, excessive intake of Guru, Snigdha and Abhishyandi Ahara, Vegadharana, suppression of natural urges, excessive stress and overthinking, irregular dietary habits and timings. Lakshanas, Panipada Sputana, Tivra Vedana, Kandu, Rukshata and Kharata. Samprapti, Nidana Sevana leading to aggravation of Vata and Kapha doshas. Doshas in Prakopa vitiate Tvak, Mamsa and Rakta dhatus, while Vata causes dryness and roughness leading to Padasputana with pain. Kapha causes thickening of skin leading to hyperkeratosis of palms and soles, which ultimately leads to fissuring of skin surface causing Vaipadika. Chikitsa treatment protocol. Patient was given with Mahamanjista Kashaya 20 ml BD before food and Kaishara Guggulu 1 tablet BD after food, Arogyavardhini Vati 1 tablet BD after food, Saptashama Gutika 1 tablet once daily. And for the external application, she was advised to take Sinduradi Lepam before. Okay, these are the images of the patient showing before treatment and after treatment. The patient was strictly advised to follow proper pathya and she was advised to avoid non-veg food during the treatment, and she was strictly followed up for the period of 3 months, and dietary regulations and ahara vihara regulations has been guided. So the patient followed all these regulations for 3 months along with proper medication. Patient is advised with patyaharas like Purana Shali, Patola, Lagu Ahara, and viharas like Pada Abhyanga with Jatyadi Taila, and proper sleep wake cycle, and to avoid certain foods like Dadi and certain habits like Ratri Jagarana, excessive walking, and to keep her mind calm without stress and overthinking. Although Vaipadika is a chronic and challenging condition, with Ayurvedic management and especially focusing on Ahara Vihara and regular follow-up of patient with proper guidelines, the patient got treated within 3 months of duration. It is observed that correcting the diet and sleep-wake cycle of patient has shown better improvement. Ayurveda has been proving to work wonders even in chronic disease conditions that are quite difficult to treat like Vaipadika. Thank you for the patient listen.
Thank you, Doctor. Thank you for the well-explained presentation. And next we go to the another paper presentation. I'd like to invite Dr. Pullela Sujana for the paper presentation.
Good evening, everyone. Myself, Dr. P. Srujana from Kai Chikitsa Department of Dr. NRS Government Ayurvedic College, Vijayawada. Today, I am going to present on topic importance of Padabhyanga in Gridrasi. Acharya Charaka specifically he mentioned about Nacha Gridrasi as an indication of Padabhyanga. But we are not giving that much importance to Padabhyanga in our clinical practice of Gridrasi. Maybe it is not mentioned in Chikitsa Sutra of Gridrasi. So in this presentation, we will see why Padabhyanga is essential in Gridrasi. In present era, diseases affecting locomotor system are most common and Gridrasi is one among them. Gridrasi is derived from the word Gridra, which means vulture, and it is one of the 80 types of Nanatmaja Vatavyadi. Gridrasi Shabdena Gridrasi Shulam Gruhyate, which means the pain is similar to the Gridra piercing its beak deeply in the flesh and drawing out forcefully, causing severe pain. And also it represents the typical characteristic gait of the patient. Gridrasi is such a Ruja Pradhana Vatavyadi. And the symptoms mentioned in our Samhitas are like Spikpurva Kati Prushtoru, Janu Janga Padam Kramat, Gridrasi Stamba Ruktode Grugnati, Spandate Muhu, Vata Dvata Kafatandra, Gauravarocha Kanvita. It is mainly of two types, Vataja and Vata Kafaja. And Nidana Sevana like Ruksha, Shita, Lagu Ahara, Ati Vyayama, Ati Asatmya Ahara Sevana, Vegadharana, and today's sedentary lifestyle like prolonged sitting or standing posture, improper postures, heavy lifting of weights, trauma, sudden jerks, it leads to the Vata Prakopa. Especially Apanavata Dushti happens. This Apanavati gets accumulated or it takes Sanchya and Prasara in Kati region, and it takes Thana Samshaya in Kandara and Snayu of the Spik, Kati, Uru, Janu, Janga, and Pada, and it manifests symptoms like Shula, Toda, Stamba, Spandana, Daha, and Ruk in the along the sciatic nerve. In modern also, the sciatic nerve takes origin in the lumbar region and passes along the foot. And we all know that the sciatic nerve is commonly divided into tibial and common peroneal nerve. These are the two branches of the sciatic nerve which terminates inside the foot. Any pathological changes at this root level causes neurological dysfunction and painful motor restrictions. So Abhyanga. What is Abhyanga? According to Amarkosha, Abhi Upasarga and Anga Dhatu makes the word Abhyanga, which means to induce specific movements on the body. According to Shabda Kalpadruma, Abhyanjana means to smear or to anoint. So Abhyanga is a type of Bahya Sneha, either it is Thanika or Sarvadahika, applying Sukoshna Taila over Pada, followed by gentle movement. So our Samhitas mentioned some special sites for Abhyanga. Shira, Shravana, Pade, Shutam, Visheshena, Shilyat. Shira, Shravana, and Pada are the special sites for Abhyanga. So these are the benefits of Abhyanga mentioned in our Samhitas, like according to Ashtangridya, Abhyanga Machare Nityam Sajara Shrama Vataha Drusti Prasada Pushtyayu Swapna Sutvakta Dadyakrit. In Charaka Sutra, it is mentioned like Karatam Stabdata Rauksham Shrama Suptischa Padayo Sadya Evopashamyati Pada Abhyanga Nishevanat Jayate Saukumaryam Cha Balam Stairyam Cha Padayo Drusti Prasadam Lavate Maruta Shopasamyati Nacha Syad Grudrasi Vataha Padayo Sputanam Nacha Na Sirasnayu Sankocha Padabhyangena Padayo. And it also mentioned in Charka Sutra like Tada Shariram Abhyanga Drudam Suktvakta Jayate Prashanta Maruta Badam Klesha Vyayam Asangraham. According to Sushtudacharya, Nidra Karo Deha Sukascha Chakchushayushyaha Shrama Suptinut Padatvak Nudukaricha Padabhyanga Sadahitaha. According to Vagbhatacharya, Padabhyangastu Tatsairyam Nidra Drushti Prasadagrut Pada Sukti Shrama Stamba Sankocha Sputana Pranut. By this we can see that all acharyas mentioned like by regular doing of Padabhyanga, it helps, it acts like Vatahara and it reduces Stamba and also Sukti. Why Padabhyanga in Grudrasi? Mostly we use Tilataila for Abhyanga. Tilataila is having Vyavayi, Vikashi and Sukshma Guna, which helps the oil to cross all over the Dhatu from Rasa to Asti and reach up to Majja Dhatu. Snigdha Guna will help in reducing Ruksha Guna, reducing Kafakshaya and Majja Dhatu Kshaya. Guru Guna of Taila acts as Vatahara, Kafahara, Pushtikara. Mruduguna reduces Stamba, Saraguna mobilizes the Dosha and Mala. So regular practice of Padabhyanga helps in managing sciatica. As we know, Vayu Mahabhuta is predominant in Sparshanendriya. It helps in maintaining Vata dosha, enhancing blood circulation and improve peripheral circulation. It stimulates the marma on the feet, which effectively improves the blood and lymph circulation. So these are the marmas in the pada, like Shipra marma, Tala Hrudya marma, Kurcha marma, and Gulfa marma. Shipra marma, it is located between first and second toes. It helps by applying Padabhyanga to Shipra marma. It helps in localizing Vata Shamana, decreases acute foot spasm. It Tala Hrudya marma, it is located in the center of the soul. It improves distal peripheral vascularity, calms hypersensitive pain networks. And Kurcha marma, it is located proximal to the Shipra marma. It relieves Tamba, and Gulfa marma, it is located in the ankle joint junction. It promotes flexibility and eases tension in the Achilles tendon area. So effect of Abhyanga in different dhatus, like by doing Padabhyanga for 300 matra kala, it reaches up to the Romakupa. 400 matra kala, it reaches up to Tvak. 500 matra kala, it reaches up to Rakta Dhatu. 600 matra kala, it reaches up to Manthu Dhatu. 700 matra kala, it reaches up to Medo Dhatu. And 800 matra kala, it reaches up to Asti Dhatu. 900 matra kala, it reaches up to Majja Dhatu. There is a sciatic reflex area band in the middle of the head that runs horizontally, where the sciatic nerve branches like tibial and common peroneal nerve branches ends. Vitiation at this root manifests structural and functional deficits at the terminal end. Padabhyanga done at this area helps in preventing sciatica and also pain management in the sciatica. This Padabhyanga acts directly on the high diameter A beta tactile nerve fibers, and it inhibits the pain transmission pathways of smaller and slow conducting C fibers at the level of the dorsal horn of the spinal cord. It also actively accelerates the venous and lymphatic return around the nerve bifurcations, and it helps in eliminating painful inflammatory cytokines, reducing facial tension, and increases vital oxygenation along the perineural structures. So, Kshipra Marma, Talahrudiya Marma are Kalantar Pranahar Marmas, and Kucha Marma is Vaikalyakara, and Gulfa Marma is Rujakara Marma. So, it is very important to practice Padabhyanga in proper way. And as Pada has direct access side to the prana, it is very important. Making it as a part of our dinacharya is very helpful. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. And next we go to another paper presentation on the topic Ababahuga. I would like to invite Dr. Pudi Gautami for the paper presentation.
Very warm welcome to one and all. My name is Dr. Puti Gautami, a second year PG scholar from the Department of Kai Chikitsa, and I am from Dr. NRS Ayurvedic Medical College, Vijayawada. Today's the topic of discussion is about Apabahika, and this will discuss about the pathogenesis, about the classical references, about the role of Nasya with respect to Apabahika. So, what is the word Apabahika means? Apa means dysfunction or any restriction, and Bahu means the upper limb. So here we can say that it is the restriction or dysfunction of a upper limb. So the author says mainly the affected place is Amsa Sandhi. So in the modern we can also correlate with adhesive capsulitis. So if we talk about the Amsa Sandhi Vivechana, this is the upper joint, this is the major joint of upper limb. This is one type of Chala and Ullukala Sandhi. So it is formed by the combination of three bones, that is Pragandhasti, Akshakasti and Amshafalakasti. So Sleshika Kapha is present in the joints and acts as a lubricant and helps in protection and the movement of Sandhi. Pratanavati type of Snayu cover this Sandhi. So this is about Amsa Sandhi Vivechana. So Amsa Sandhi and Marma. What are the marmas present in the Amsa Pradesha? That is Amsa Marma. It consists of Murdha, Griva and Bahu. It is formed by the union of that glenoid and acromioclavicular joint. This glenoid joint we can correlate with the Amsa Pidha, and acromioclavicular joint is Skanda. So this is the Snayu Marma. And Amsa Marma consists of Mamsa, Sira, Snayu, Sandhi and Asti. But it is Snayu Marma. It is one of the Vaikalyakara Marma, and any trauma to this will produce disability or deformity of the shoulder joint. This is about the Amsa Sandhi and Marma. Now coming to the classical classifications and what our authors said in our Brihatrayi and Lagutrayi and some others commentaries, now we will see. Charaka says it as Bahu Shiragata Vata, and Shushrata says it as Avabahika, and Vagbata also says as Avabahika. So Dalhana, Arunadatta and Hemadri, these analyzed the Avabahika in detail, and Madhavanidhana, he is the first person to differentiate it from Bahu Shosha. He is the first person. He is the first one to differentiate it from Bahu Shosha. And Bhava Mishra and Sharangadhara, they told so many rasaushadis and related to Avabahika. and the different Chikitsa yogas are mentioned for Avabahika by Vangasena, and Brihat Niganta Ratnakara and Nidhana Sara, etc. These also discussed about this Avabahika in and their management in detail. So here the main important is about Charika, Shishuta and Vagbata. But you have to remember that Charika, he told about this Bahu Siragata Vata. He didn't mention about Avabahika or Apabahika. He said it is about Bahu Shiragata Vata. And we also have this Vangasena, and he described about different types of nasya that can be incorporated in Apabahika, and he says about Sheetala Jala Nasya, and he also mentioned about Jingini Nasya and about the Dashamula Nasya. We should make some kashaya from the Dashamula, and we should instill in the nostrils, and he told about different types of nasya which were not mentioned by all others. He told about nasya his aspect is about nasya in a different manner. The rupa, the cardinal features of the Apabahika are Bahu Praspandahara, Amsha Shula and Stamba, and Amsa Bandhana Shosha. So these are the rupa of Apabahika. Coming to the Chikitsa, the line of management, that is our Acharya says that Apabahikam Hitam Nasyam Snehascha Uttara Bhaktikaha. This is told by Ashtanga Hridaya in Apabahika Chikitsa, and our Acharyas mainly tell about Snehana, Svedana and Nasya, Bastikarma and Siravyadana. These are the main treatment protocol, Shodhana treatment protocol that will be followed for Apabahika. In Samanya Chikitsa for Vatavyadi is Snehanam Sweda Samyuktam, Snehanam Svedanam, Mrudu Shodhanam, Sirovasti and Nasya. Here it says about the Samanya Chikitsa of Vatavyadi, the general line of treatment for localized and systemic Vata disorders. It utilizes Snehana, Svedana, Mrudu Shodhana, Basti, Shirovasti and Nasya. The Charaka, he mandates specific and customized therapeutic interventions based on the involved sthana, that is the site of location, and dusha. And Vagbata establishes that for all the Udva Jatrukata Vata Vikaras, Nasya Karma is the supreme treatment. Vishesha Chikitsa according to different authors. According to Ashtanga Hridaya, he says about Nasya and Uttara Bhaktika Snehapana, and Ashtanga Sangraha, he says about Navana Nasya and Snehapana, and Shushruta Samhita, he says about the Samanya Vatayadi Chikitsa, except Siravyada. Siravyada should not be done in Avabahika according to Shushruta. And according to Chikitsa Sara Sangraha, he tells about Nasya and Uttara Bhaktika Snehapana and Sveda, and according to Acharya Vagbata, he says about Brahmana Nasya, and Acharya Chakradatta, he says about Nasapana. Nasapana is a special procedure which is told by Chakradatta. Nasya, a gate to the upper body. Here, in our classicals, they say Nasahi Sirashodvara. Acharya Vagbata establishes that the nose is the direct gateway to the head and upper body. Nasya acts on Apabahika via key mechanisms. You know that Stringataka Marma stimulation, the active principles of the warm medicated lipids diffuse through the nasal mucosa to the Stringataka Marma, spreading down into the neck and shoulder roots. The face-specific oil formulations like Lagumasha Taila or Masha Taila that counter the muscle wasting, and Karpasasthyadi Taila for cervical nerve irritation, and high-potency Ksherabala Taila, that is 101 Avartini, for joint hydration. And coming to the mode of action, according to Ayurvedic pathway, Stringataka Marma stimulation, the lipophilic nasal formulations cross the mucosal barrier and stimulate the vital marmas at the base of the skull, which govern the upper body quadrant. And Avarana Vighatana, that is hot penetrative processing drops, digest the local microchannel blockages caused by the kapha, clearing the path to the Vyana Vayu, and it causes nourishment delivers the direct lipid lubrication to dry and constricted tendons, that is snayu, and khandara, that is muscles of the neck and shoulder base. And the modern biomedical pathway, that is transnasal mucosal transport. This is a bioactive phytoconstituents directly penetrate highly vascularized nasal epithelium, bypassing the blood-brain barrier via the olfactory and trigeminal pathway. Autonomic reflex vasodilation, that is by chemical or thermal stimulations, trigger the rapid localized vasodilation in the shoulder region, flushing out the ischemic pain mediators. And the brachial plexus decompression reduces the perineural edema and paraspinous muscles and spasm surrounding the cervical nerve roots. So this is about the classical bibliography and the medical and modern research about the Apabahika, and thank you for giving me this opportunity.
Thank you, Doctor. Thank you for the wonderful presentation. Next, I would like to invite Dr. Harshini T for the poster presentation.
Warm good evening to everyone. Myself, Dr. Harshini T, MD Scholar, Department of Kaya Chikitsa, Dr. NRS Government Ayurvedic College, Vijayawada, Andhra Pradesh. My topic is effectiveness of Ayurvedic treatment protocol in Indralupta with respect to alopecia areata, alopecia barbae, single case study. Introduction. Hair is considered an important component of personality and health. Nowadays, we can see tremendous ailments related to hair like hair fall, graying of hair, alopecia, etc. It affects self-esteem and confidence, further leading to stress, which may lead to depression. Alopecia areata is an autoimmune disorder characterized by non-scaring, patchy hair loss due to T-cell mediated destruction of anagen hair follicles. Alopecia barbae is a localized variant of alopecia areata affecting the beard region. Contemporary treatment includes steroids, topical, systemic, and injectable modalities, and immunotherapies. It is having more adverse effects with chance of recurrence. In Ayurveda, it can be correlated with Indralupta. It is explained under the heading of Shudra Rogas and one among the Rakta Pradosha Vikara by Acharya Sushruta, under Kapalagata Shilaroga by Acharya Vagbada, and Acharya Charaka mentioned it in Trimarmiya Adhyaya. It is having synonyms are Chacha and Ruhya. Ayurveda emphasizes the involvement of all three doshas along with Rakta Dhatu. Vitiated Pitta in association with vitiated Vata causes the falling of hair from the scalp. After that, vitiated Rakta and Kapha block the orifices of the hair follicle, which restrict the growth of new hair. Thus, Vata, Pitta, and Kapha dosha and Rakta doshas are the main doshas involved in the Indralupta. So, Ayurvedic Samprapti, due to Nidana Sevana, dosha prakopa, initially Vata, Pitta involvement will be there, and then Rakta Dushti leads to Kesha Padana, falling of hairs. Finally, it ends up in Kapha Avarna and Roma Kopa, so no new hairs will be grow. And finally, patient is experiencing Indralupta, a patchy hair fall. In modern, like normally our hair is having immune privilege. Due to repeated stress and environmental triggers, our hair will lose this immune privilege and it will lead to patchy, non-scarring hair loss. We will see the mechanism. Due to causative factors, activation of CD8 plus T cells will be there. This leads to increased interferon gamma and interleukin 15, and this attacks on anagen hair follicles and leads to premature follicular arrest. And finally, it ends up in patchy, non-scarring hair loss. So these are the pathogenesis based on Ayurveda and modern for Indralupta and alopecia areata and barbae. Now we will see the case presentation. Patient information, name, age 32, gender male, occupation is marine engineer, chief complaint, patchy loss of scalp hair and beard hair since 2 months, mild itching over affected area, hair fall while combing. History of present illness. The patient was apparently normal before 2 months. Gradually, he noticed a circular patch of hair loss over the occipital region of scalp along with the loss of beard hair at the left mandibular region associated with mild itching and hair fall. No pain or discharge was present. Stress and an irregular diet were significant triggering factors noted. Past history, like no history of comorbidities, no family history. Personal history, appetite is good, sleep is disturbed due to his work, bowel and micturition is regular, diet like mixed and excessive intake of sour, salty, spicy foods and junk foods. Addiction, like he used to take excess of tea. Ashtasthana Pariksha, Nadi is Vadapitta, Malamutra is Prakrita, Jihva is Alipta, Shabda Prakrita, Sparsha Anushna Shita, Drika is Prakrita and Akriti is Madhyama. General examination, BP is 120/80 mmHg and pulse is 78 beats per minute. Paloectocyanosis, clubbing, lymphadenopathy, edema, everything is absent. Systemic examination, respiratory, CVS, CNS, GIT, no abnormality detected. Intercomentary, single circular bald patch over occipital region of scalp. It is approximately of 2 to 3 centimeter, and single circular bald patch at left mandibular region. It is also approximately of 2 to 3 centimeter. In smooth, non-scarring surface, no erythema and no scaling. Diagnosis, Ayurvedic diagnosis, it is of Indralupta, and modern diagnosis is alopecia areata and alopecia barbae. Here, treatment is, we started with Sadhya Vireshana with Ayurvedic Churna of 25 grams, Anupana warm water at early morning 6 a.m. and we advised weekly twice Panchakarma done with derma roller. 0.5 mm derma roller is used. Shamana Chikitsa, Aragyavartini Vati 500 mg BD for duration of 1 month, and Narasimha Rasayana 1 teaspoon with milk at bedtime. Malatya Thailam external application. These two medicines like Narasimha Rasayana and Malatya Thaila is used for 2 months. Patya advised is Patya, green leafy vegetables, Amalaki, Kshira, Grita, Pranayama. Apatya is excessive spicy food, junk food, Ratri Jagaranam, Krodha, Shoka, Baya. Result we got parameter, hair fall, bald patch size, hair regrowth and itching. And before and after treatment, hair fall is of severe, and after treatment it is very mild. And bald patch size is before it is of 3 centimeter in image, clearly it is showing. After treatment it is of 0 centimeter, no patches, and he's having like hair regrowth. Before it was absent, and after treatment it was present, like fully it does, like hair regrowth has happened. Itching, before it was mild and after it was absent. This image clearly shows before treatment and after treatment. Conclusion, the present case study demonstrates that Ayurvedic management can provide significant improvement in Indralupta with respect to alopecia areata and alopecia barbae. The combined approach of Shodhana and Shamana Chikitsa along with appropriate dietary and lifestyle modification helped reduce hair fall, relieve itching, and promote complete hair regrowth without adverse effects. The therapies acted by correcting dosha imbalance, Rakta Shodhaka, Strota Shodhanam, and Rasayanam. This case highlights the potential role of Ayurveda as a safe and effective alternative approach in the management of alopecia areata, and no recurrence is there in this case. However, further clinical studies with large sample size are required to significantly validate these findings. Thank you.
Thank you, Doctor. Thank you for the valuable presentation. Next, we go to the another paper presentation. I would like to invite Dr. Nayana Jairaj for the paper presentation.
Good evening, everyone. I'm Dr. Nayana Jairaj, second year PG scholar, Department of Panchakarma, Sri Jayendra Saraswati Ayurveda College and Hospital. Today, I'll be presenting on the topic effect of Bahya Snehana and Svedana in muscles. Muscle is a specialized contractile tissue of mesodermal origin composed of elongated cells, capable of contraction and relaxation to produce movement, maintain posture. Total number of muscles are 639. General properties of muscle tissues are excitability, conductivity, contractility, extensibility, and elasticity. Types of muscles based on structure and control: skeletal muscles, smooth muscles, and cardiac muscles. These are the properties of skeletal muscles, smooth muscles, and cardiac muscles. Functional classification of skeletal muscles. Agonist, main muscle responsible for specific movement, that is a prime mover. Example, biceps brachii in flexion of elbow. Antagonist, the muscle that opposes or reverses the action of agonist. Example, triceps brachii, antagonist to biceps brachii during elbow flexion. Synergist, a muscle that assists the agonist by adding force or preventing unwanted movement. Example, brachialis assists biceps in elbow flexion. Fixator, a muscle that stabilizes the proximal part of limb so that the distal movement can occur efficiently. Example, trapezius and rhomboids fix scapula during arm movements. Neutralizer, a muscle that prevents the unwanted action of the agonist. Example, supinator neutralizes pronation action of biceps during pure elbow flexion. Based on direction, parallel, non-fusiform, example sartorius, fusiform, example biceps brachii, pinnate, unipinnate, example extensor digitorum longus, bipinnate rectus femoris, multipinnate deltoid, circular, example orbicularis oris, convergent, example pectoralis major. Based on number of heads, biceps, triceps, and quadriceps. Anatomy of muscle. Muscle is attached to bone by tendon. Muscle bundle is wrapped by epimysium. Inside muscle bundle, fascicles are there, which is wrapped by perimysium. And inside fascicles, muscle fibers are there, which is wrapped by endomysium. This muscle fiber again contain rod-like structures known as myofibrils. And myofibrils are the one which contain thin actin filament and thick myosin filament, which helps in the contraction and relaxation of the muscles. പേശി ശരീര മാംസ അവയവ സംഘാത പരസ്പര വിഭക്തോ പേശി ഉദ്ദിച്ചത്. Pesha Sankhya, according to Acharya Shushruta, 500 Peshi are there, 400 in Shaga, Koshta, 66, Jatrurdam, 34. And in Stri, 20 extra are there, in Stanya, 5 in each, total 10, Avatyabada 4, Garbha Chitra 3, and Shukra Artava Praveshini 3. This is the classification of Peshi and the probable modern correlation with example. For example, Behala Peshi may be correlated at large muscles, example pectoralis major, Pallava Peshi thin muscle, serratus anterior and posterior, Stula Peshi gross muscle, gluteus maximus, deltoid, etc. Importance of muscle. Sira snayasti parvani sandhyascha shariranam peshibihi samrdhanyatra balavanti bhavantyatah. Pathophysiological abnormalities of muscles. Hypertonicity. Physiological definition. Abnormal increase in muscle tension may be correlated as Mamsagata Vada or Stamba. Myofascial trigger points. A tiny patch muscle fibers that are stuck in constant state of contraction may be correlated as Mamsa Granthi or Shula. Muscle atrophy. Thinning or loss of muscle tissue. Example, may be correlated as Mamsa Kshaya. Facial adhesions, cross-linking of collagen fibers in the extracellular matrix, microscopic micro tears in muscle fibers, Shrama. Effect of Snehana and Svedana, Ayurvedic perspective. Snehana, Snehanam, Sneha Vishyanta Madhavam, Kledakaragam, Svedanam, Stamba Gauri Vishidakram, Svedanam, Svedakaragam. So the guna of Snehana is Snigdha, Guru and Slakshna. Svedana is Ushna, Tishna and Sara. Karma, Mardavada and Snehana. In Svedana, it is Stambagna. Effect of Dadu, Mamsa Pushti in Snehana and Mamsa Shaiti Leda in Svedana. Effect on Vada pacifies Vyara Vayu and Svedana removes Padhavarna. Physiological effect of Bahya Sneha. Snehana acts through three primary pathways: mechanotransduction, neuromuscular modulation, and transdermal pharmacokinetics. Mechanotransduction and cellular signaling. Mechanotransduction is a fundamental biological process where cells convert mechanical stimuli like touch, pressure, or tension into biochemical signals. It happens through mitochondrial biogenesis. Research indicates that massage stimulates the expression of PGC1 alpha, which stimulates the production of mitochondria, enhancing the muscle's aerobic capacity and ATP turnover. Anti-inflammatory signaling. It downregulates nuclear factor, reducing the production of pro-inflammatory cytokines like TNF-alpha and interleukin-6. Neuromuscular reflex modulation. Autogenic inhibition. Deep pressure stimulates Golgi tendon organs. These receptors send inhibitory signals to the spinal cord, which inhibits alpha motor neuron, causing immediate muscle relaxation and resetting of resting tone. Gate control theory. Stimulation of large diameter A beta fibers through cutaneous rubbing inhibits the transmission of pain signals. Transdermal pharmacokinetics. Ayurvedic oil serves as lipid-based drug delivery system. Lipid-soluble alkaloids, for example, vithanolides from ashwagandha, penetrate the stratum cornea via the intercellular lipid pathway and hair follicles. Once in the dermis, these molecules enter microcirculation and diffuse into perimysium and endomysium, providing direct antioxidant and anti-inflammatory support to the myocytes. Thyla absorption mechanism. Short chain fatty acids and medium chain fatty acids act as signaling molecules. They bind to specific receptors on muscle cells and regulate energy metabolism and reduce systemic inflammation. They bypass the complex transport system and can be used by muscle mitochondria almost immediately for repair. Long chain fatty acids are the primary components of sarcolemma. Muscles have high density fatty acid binding proteins. These proteins acts like magnet that pulls long chain fatty acids from interstitial fluid into the muscle fiber to repair micro tears and build mass. In Abhyanga, short chain fatty acids and medium chain fatty acids act as natural surfactants. They thin out the skin sebum, making it easier for the long chain fatty acids to penetrate. Long chain fatty acids carry the active principles. Importance of Tirathaira. Tirathaira have high concentration of oleic acid. It's a long chain fatty acid. It acts as a skin penetration enhancer and antioxidant. As a result of a high concentration of long chain fatty acid, more activated particles will be carried. Physiological effect of Svedana. Salt gel transformation. The muscle is surrounded by extracellular matrix containing hyaluronic acid. In stiff state, the extracellular matrix is in a gel state. When we are giving Svedana, the heat induces salt transition, making the interstitial fluid less viscous. This reduces internal friction between muscle fascicles, improving the sliding filament mechanism. Metabolic and vascular dynamics, the Q10 effect or Van Hoff's law. For every 10 degrees Celsius raise in the tissue temperature, the metabolic rate increases 2 to 3 times. This speeds the enzymatic repair of damaged muscle protein. Thermal vasodilation or the washout effect. Increased temperature causes capillary dilation. The resulting vasodilation washes out metabolic byproducts such as lactic acid, urea, bradykinins, which are responsible for muscle fatigue. Integrated action of Snehana and Svedana in muscular diseases, muscular dystrophy, primary muscle pathologies, membrane instability, and leaky calcium channels. Snehana and Svedana intervention. Snehana provides exogenous lipids to stabilize the sarcolemma and prevent oxidative damage. Spasticity, hyperexcitability of the stretch reflexes. Snehana inhibits the gamma motor neuron activity, reducing the sensitivity of the muscle sphincter. Myofascial pain, ischemic nodes. Svedana causes vascular dilation, increased blood flow, hypoxia is resolved. Fibromyalgia, central sensitization and facial stiffening. Snehana stimulates A beta fibers to modulate pain perception. Thank you.
Thank you, Doctor. Thank you for the excellent presentation. Next, we go to the another paper presentation. I would like to invite Dr. K. Nikita for the paper presentation.
Good evening, everyone. Myself, Dr. K. Nikita, final year DGPG, guided by Dr. K. Madhusudan Rao sir, and I'm from Dr. NRS Doctor in Ayurvedic College. Today, my topic is milk and fish incompatibility. Contains introduction, comparison between milk and fish, Ayurvedic concept, modern concept, conclusion. Virudahara. When two or more ahara or dravya are combined and it acts incompatible to the body, it is called as virudahara. Yet kinchit dosham asravyam na nirharayati kayatah ahara jatam tat sarvam ahitayopapadyate. Charaka Sudrasana 26th chapter 85th shloka. The entire diet or drug which excites the doshas but does not expel it out of the body and becomes harmful to the body is called as virudahara. Rasapanchak of milk and fish. Madhura rasa, guru snigdha guna, shita virya, madhura vipaka, vata pittahara, kafakara. Madhura lavana rasa, guru snigdha guna, ushna virya, madhura vipaka, vatahara and kafa pitta kara. Here, shita virya and ushna virya. This is the incompatibility. Charakacharya and Sutrasthana explained it under Virya Viruddha. Milk is having Shita Virya, it suppresses the Agni and decreases the metabolic activity. Fish is having Ushna Virya, it stimulates the Agni and increases the metabolic activity. This represents the opposite physiological signals to the Agni. What happens at the level of Agni? Conflict signals to the Jatrakni, asynchronous digestion, incomplete transformation. Shita Virya of the milk suppresses the Agni, while Ushna Virya of the milk stimulates it, leading to functional disorganization of Jatrakni, resulting in asynchronous digestion, apakva ahara rasa formation, and ultimately ama is formed. Let's see the pathogenesis. Viruddhahara. This causes Agnimandya and this leads to ama, and then Shrotarodha and Marghavarata, Avarodha. And now ama dosha samurchana. This leads to Rakthadushti, Sthana Samshaya, and Vyakti, that is skin disorders. Here the vitiated dosha is Pitta. Here ama and dosha samurchana is vitiated dosha combines with ama. And this leads to Rakta Dushti. As Pitta is vitiated, it causes the Rakta Dushti. And Rakta Dushti takes Sthana Samshaya at Twak. As Twak and Rakta are closely related, Rakta nourishes the skin. So Dushita Rakta causes manifestation at the level of skin. And we also know that Pitta, that is Rajaka Pitta, it maintains the color of the skin. Here the vitiated pitta leads to vitiation of Rajaka pitta and then leads to the vitiation of the skin and it manifests the diseases. This is how the skin disorders is manifested. So example Khandu, Raga, Daha and Shita pitta. Modern concept, histamine and biogenic amines. Usually fish contains histamine and especially when it is stored, high histamines are produced. High histamine condition is also known as Cromroy poisoning. What histamine does? It enters the bloodstream, binds to the H1 receptors in skin and vessels. Vasodilatation, flushing, which is nothing but which it causes the redness in the skin. We can see it in the picture. Nerve stimulation it leads to itching. Increased permeability causes rashes. What is the milk role in this? Milk means slow digestion because it is heavy to digest. Delayed gastric emptying. Fish remains, because of the delayed gastric emptying, fish remains longer in the stomach. This increases the bacterial activity. More bacterial activity, more biogenic amine formation. Affect gut barrier. Improper digestion leads to gut irritation. Gut irritation leads to increased permeability. That is the leaky gut concept, and it causes antigens enter the bloodstream, and this leads to immune response. Now let's see the combined effect. When taken together, increased histamine, increased absorption or delayed clearance leads to gut inflammation, and then it leads to immune activation. The result is pseudo-allergic reaction and skin manifestation. Protein digestion conflict. Fish. Fish is rich in easily digestible animal proteins, and milk contains casein and lactose. Different digestion rates. As a fish is having the easily digestible animal proteins, it digests fastly, and milk is having heavily digestive proteins, that is casein and lactose, it digests slowly. This leads to gut stress and leads to fermentation. It produces ammonia organic acid, leads to gas, bloating, dysbiosis. Allergic proteins. Fish contains parvalbumin, milk contains casein and whey. Usually some people are allergic to few proteins. So here this triggers IgE mediated reactions in the sensitive individuals and release histamine leukotrienes. This leads to eczema, GI symptoms. Conclusion. The incompatibility of the fish and milk is a well-known example of Veera Viruddha described in Veera Ayurveda. Due to their opposing potencies, combination may impair digestion, vitiate doshas, and contribute to the formation of toxins, that is ama. Long-term consumption is considered harmful and may lead to various systematic and dermatological disorders. Therefore, Ayurveda recommends avoiding this incompatible dietary combination to maintain balance, health, and longevity. Food becomes medicines only when consumed in the right combination. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Next, I'd like to invite Dr. Shraddha Dilip Chauhan for the poster presentation on the topic Registrala Varjetia.
Morning, respected chairpersons, judges, faculty members, and fellow delegates. I am Dr. Shraddha Chauhan from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune, Maharashtra. Today, I am presenting a poster on Rajaswala Paricharya, Ayurvedic guidelines for menstrual health and well-being. Menstruation is a natural physiological process experienced by women during their reproductive years, while modern medicine focuses on hygiene and symptom management. Ayurveda provides a comprehensive approach that includes dietary, behavioral, and lifestyle recommendations during menstruation. This regimen is known as Rajaswala Paricharya. The primary aim of Rajaswala Paricharya is to maintain physical and mental well-being, preserve reproductive health, and prevent future gynecological disorders. Concept of Rajaswala Paricharya. According to Ayurvedic classics, menstruation is considered a physiological cleansing process of the female body period upon Vata or subtype of Vata dosha responsible for downward bodily functions plays a dominant role. Any disturbance in upon Vata may affect menstrual flow and reproductive health. Therefore, Ayurveda recommends specific practices during menstruation to support the natural functioning of the body and maintain dosha balance. Dietary guidelines. Pathya. Ayurveda advises consumption of light, warm, and easily digestible food during menstruation. Recommended foods include yavagu or medicated grape, khichdi, moong dal preparations, freshly prepared warm meals. These foods are easy to digest and help conserve energy while supporting proper digestion and metabolism. Adequate hydration and a balanced diet also contribute to overall menstrual health. Foods and practices to avoid, that's apatya. Certain foods and activities are discouraged during menstruation because they may aggravate doshas and increase discomfort. This includes spicy and oily foods, fast foods, and processed foods, excess tea and coffee, alcoholic beverages, cold drinks. Similarly, activities such as heavy exercise, excessive travel, heavy lifting should be avoided as they may increase physical strain and disturb normal menstrual physiology. Lifestyle guidelines. Ayurveda emphasizes adequate rest during menstruation. Women are advised to take sufficient sleep, avoid overexertion, maintain a calm and stress-free environment, engage only in light daily activities, practice relaxation and meditation. These measures help conserve energy and support the body's natural healing process. Behavioral guidelines. Behavioral discipline is another important aspect of Rajaswala Paricharya. Ayurvedic texts advise avoiding excessive physical activity, sexual intercourse, night awaking, emotional stress, excessive traveling. The rationale behind these restrictions is to prevent disturbance of Uppan Vata and allow the body to function optimally during menstruation. Hygiene measures. Although ancient Ayurvedic texts were written in a different era, the principle of cleanliness and personal hygiene remain highly relevant today. Important hygiene practices include regular changing of sanitary pads or absorbents, maintenance of genital hygiene, use of clean absorbent material, bathing with warm water, proper hygiene helps reduce the risk of infection and improves comfort. Ayurvedic rationale. From an Ayurvedic perspective, menstruation is predominantly governed by Apan Vata. Excessive physical exertion, mental stress, improper diet, and inadequate rest may disturb dosha balance. Rajaswala Paricharya aims to maintain physiological equilibrium by supporting the body's natural process. Thus, it is not merely a set of restrictions, but a preventive healthcare strategy designed to protect reproductive health. Many recommendations of Rajaswala Paricharya can be correlated with modern scientific understanding. For example, adequate rest helps in reduced fatigue and menstrual discomfort. Balanced nutrition supports hormonal regulation. Stress management positively influences menstrual well-being. Proper hygiene reduces the risk of reproductive tract infections. This observation suggests that traditional Ayurvedic guidelines continue to have practical relevance in contemporary healthcare. Benefits of following Rajaswala Paricharya. Regular adherence to Rajaswala Paricharya may offer several benefits: reduction in menstrual discomfort, better menstrual regularity, improved hormonal balance, enhanced reproductive health, reduce stress and fatigue, improve quality of life. Therefore, these practices can serve as valuable preventive measures for women's health. Consequences of non-compliance, dysmenorrhea or painful menstruation, irregular menstrual cycles, increased fatigue, hormonal imbalance, reproductive health disorders, increased susceptibility to infections. Conclusion. To conclude, Rajaswala Paricharya represents a holistic Ayurvedic approach to menstrual health and integrates proper diet, lifestyle regulation, behavioral discipline, and hygiene practices. Many of its principles are also supported to modern scientific understanding, highlighting its relevance even in contemporary times. Thank you for your kind attention. I will be happy to answer any questions.
Thank you, Doctor. Thank you for the valuable poster presentation. And next we go to the another paper presentation. I'd like to invite Dr. Pradisha Hemant Kadam for the paper presentation.
Hello everyone, my name is Dr. Pratiksha Kadam, PG Scholar, Department of Home Vidya. I'm here to present excessive use of social media in children, health challenges and Ayurvedic management. Introduction. Definition. Social media are interactive digital platforms enabling content creation, sharing, and social networking, Facebook, Instagram, YouTube. Popular platforms in children's are Instagram, TikTok, Snapchat, recorded Daily active users more than 1.5 billion globally. Evolution of digital media by web, mobile area to AI-driven feeds. Average age of smartphone is 10 years. COVID-19 impact screen time doubled during lockdown. Children aged 5 to 17 reported 6 to 8 hours a day of recreational screening exposure. Objectives: understand health effects of excessive social media use in children, identify physical and physiological consequences of digital overexposure. Third, explore Ayurvedic conceptual correlation and pathogenesis. Fourth, evaluate Ayurvedic preventive and therapeutic management strategy. Concept of social media addiction includes compulsive use despite negative consequences, characterized by silence, mode modification, tolerance, withdrawal, conflict, and relapse. Social media gives stimulus to the children, increase dopamine and reward sensation, craving for more, compulsive checking, withdrawal on restriction. Addiction criteria include silence, tolerance, mood modification, withdrawal, relapse, conflict, loss of control, physical health challenges, digital eye strain, musculoskeletal includes neck pain, backache, wrist pain, postural deformities, headache, tension type of headache, screen glare, triggers migraines in susceptible children, sedentary lifestyle, reduced physical activity, metabolic syndrome, childhood obesity, increased BMI, obesity, WHO screen time, reduce screen time more than 2 hours a day significantly increase obesity risk in children. Dry eye syndrome, reduce blink rate 12 to 4 minutes, incomplete lid closure, tear film instability, neurological impact, attention deficit, shortened attention span, cognitive overload, ADHD-like symptom, hyperactivity, impulsivity, inattention, reduced neuroplasticity, passive consumption of reduced creativity thinking, and problem-solving neural pathway development. Physiological impact, anxiety, social compression, fear of missing out, FOMO, cyberbullying, anxiety rates increase 3 times in a heavy users, depression, passive consumption linked to depressive symptoms. Girls are more susceptible than boys, low self-esteem, unrealistic beauty standards, filter images, poor body images, negative self-worth, emotional instability, mood swings, irritability when device restricted, impaired frustration tolerance, behavioral consequences, aggression, risk taking behavior, internet addiction, social withdrawal, impulsivity, cyberbullying, social consequences, social isolation, paradoxical heavy social media users report feeling more lonely and disconnected. Family conflict, device use during family time, parental conflicts over screen limits, reduce family bonding, peer relationship issues, cyberbullying, exclusion from online groups, social comparison anxiety, poor communication, reduce face-to-face interaction skills, difficulty reading non-verbal cues, emotional detachment, reduce empathy, difficulty forming genuine relationships, superficial online connections, digital citizenship gap, lack of responsible online behavior, privacy risk, susceptibility to misinformation, Ayurvedic correlation, asatmandra indriyartha sanyoga, excessive defiant or wrong contact of indriyas with artha, screen overexposure, ati yoga of chakshu indriya, Pratyapradha, knowingly engaging in a harmful behavior, ignoring the harm of excessive screen time despite knowing the consequences, defined as a misuse of the dhriti and smriti, manovasrotodushti, psychological channels get vitiated by shoka, bhaya, krodha, chinta, all of which are consequences of social media overuse. Nidan Panchak, Nidan असत्मेंद्रिय अर्थ संयोग प्रज्ञापराध रात्रि जागरण अव्यायाम अतीन्द्रिय उपयोग पूर्वरूप आलस्य शिरो अक्षी वेदना निद्रानाश मनो विभ्रम क्रोध चिंता रूप दृष्टि दौर्बल्य स्मृति नाश बुद्धि बुद्धि वैभ्रमण बुद्धि विभ्रंश Atinindra, Anitra, Unmada, Lakshana, etc. Upashaya, reduction of screen time, symptom relief, dinacharya improves sleep and energy, Medha Rasana, cognitive improvement, yoga, pranayama, anxiety reduction, Samprapti, increased screen time, affects the Indriya Artha Sanyoga, Dosha Drushti, Manova Srota Drushti occurs Manovikara, Dosha Dusha involvement, Dosha Vata causes excessive sensory stimulation, irregular routine, uh, causing clinical manifestation of anxiety, insomnia, tremors, hyperactivity. Pitta, eye strain, screen glare, anger inducing content, eye inflammation, anger, headache, irritability, kapha, sedentary lifestyle, excessive eating while scrolling, obesity, lethargy, excessive sleep, dullness. Manas dosha includes Raja Tama. Raja causes stimulating content, FOMO, social comparison, aggression, restlessness, desire, impulsivity. Tama, passive scrolling, inactivity, escapism, depression, withdrawal, confusion, delusion. Dusha, Buddhi Smriti Manas, cognitive overload, multitasking, poor learning, impaired memory, poor judgment, confusion, strotas, strotas, psychological, psychosocial stressor from social media, manovikara, causes anxiety, depression, addiction, samprapti, excessive screen exposure, satmendriyartha संयोग plus pradnya अपराधः causes vata pitta प्रकोपः, increases rajatama vriddhi, monosrotodushti occurs, and buddhi smriti vibramsha gives manovikara behavior and cognitive disorders. Samprapti vigata done by Nidan Parivarjana, Satvavajay Chikitsa, Medhya Rasayan, Yoga and Pranayam, Dinacharya, mental well-being restored. Medhya Rasayan can be Brahmi, Shankapushvi, Ashwagandha, Jata Mansi for brain rejuvenating Panchakarma management. Nasya, administration of medicated oil powders through nasal route, Anutel, Brahmi tel, Nasya, 4 to 8 drops each nostrils, improves brain function, reduces Shiro Roga, increase concentration, reduce headache, stress relief. Shirodhara, continuous stream of warm medicated liquid, Takra Shiravala Tela over forehead, 45 to 60 minute session, gives decrease anxiety and depression, improves sleep quality, calms Manas, Chirobhanga, head massage with Brahmi Tela, Bringaraj Tela, stimulate Manu point 20 to 30 minutes daily, increase blood flow to brain, decrease tension, mental clarity, Snehana, internal and external oleation with medicated Brahmi Grita, lubricates and nourishes Vata vitiated nervous channels, increase Ojasaha, neuroprotective functions, reduces Vata Prakopa, Padabhyanga foot massages, from Shirabara Telum, sesame oil activates Talarida Marma 10 to 15 minutes before sleep gives increased quality of sleep, decreased restlessness, calms nervous system. Satvavajay Chikitsa, Samadhi, meditation, breathing focus, single task training to rebuild sustained attention, cognitive behavioral therapy, identifying the triggers, restructuring the maladaptive thoughts about social media, building coping skills. Digital detoxification can be gradual screen time, reduction protocol, 10% weekly reduction, reward based milestone, parental and family counseling can be role modeling healthy device use, family media plans, structured device free hours, yoga and meditation, Tadasana, Vrikshasana, Balasana, Surya Namaskar, Alunam Vinam, Brahmari, Nadi Shodhana, Dharna Dhyan can be used for mind and body intervention. Dinacharya and lifestyle modification, Brahma Murta awakening, optimal for sattva and learning. You can cause a cortisol peak, improves alternates and focus. Yoga exercise promotes Lagu Bala, Agni Vipana, increase in dopamine, increase serotonin, and anxiety decrease, obesity, wholesome breakfast, sattvic ahara, milk, ghee, fruits, whole grains, avoid rajasic and tamasic food, can provide balanced microbes and support sustained cognitive performance. Outdoor play, Bala Krida, essential for Deha Bala, Manas Bala social development, reduces cortisol, improves sleep, builds social skills, take 3 hours, avoid Ratri Jagran and Ati Indra Upayog post sunset, protects melatonin, family bonding time, digital hygiene, Pada Abdanga sleep in Ratri Charya for Ojas prevention, gives sleep hygiene 9 to 10 hours for school children, increase memory consolidation, roles of parents for foundation of digital well-being. Parents can monitor the screen time of a child, family interaction, emotional support, encouraging hobbies such as arts, music, sports, reading, parental counseling also be there. Parents must model healthy tech use, own screen habits directly influence children's behavior. School collaboration, regular teacher-parent communication, screen time policies, digital literacy, educate from primary level. These are references. Thank you.
Thank you, Doctor. And one more poster presentation is there.
My name is Dr. Pratiksha Kadam, PG scholar Kumar Nritya. I'm presenting a case report on oppositional defiant disorder through Ayurveda. Introduction. Oppositional defiant disorder is a behavioral condition marked by persistent pattern of angry, irritable, augmentative, defiant, and vindictive behavior toward authority figures lasting at least 6 months, causing significant impairment in social, academic, and family functioning. In Ayurveda, similar presentation can be correlated with Pitta Unmada due to Tridosha variation in a person with Alpasattva affecting Mana, Buddhi, and other psychological function. Patient profile: a 14-year-old male patient come with the excessive anger and aggressiveness, poor academic interest, unable to differentiate desirable and non-desirable activities, disturbed sleep, average memory, duration up to 1 year, history, family history, father having an anger issue, general and systemic examination normal, diagnostic assessment used child behavior and checklist, score was 1, not 2, dosha dosha environment, asatmendriyarka sanyoga, improper indulgence of senses in unfavorable object leads to sensory overload, attachment, anger, delusional, loss of memory, and destruction of intellect. Prajna Prabha, misuse of intellect, the self-control driti and memory results in wrong decision making and continues harmful behavior despite awareness. Dosha involvement, manas dosha, it includes the raja and tamaguna, restlessness, impurity, ignorance, lethargy, and attachment. Due to vata involvement, anxiety, weakness, poor digestion, variable immunity, due to pitta, inflammation, irritability, hypermetabolism, due to kapha, congestion, heaviness, sluggish metabolism can be occurred. Brief case history: before 2 years, patient was normal. After 2 years, eagerness to help in unnecessary situation, drifted to wrong company, mother less attentive, lost interest in study, joined father as a driver, developed interest in driving, gradually aggressive towards family, poor mental sharpness, and inability to differentiate right versus wrong, brought to a pretty giving management, Ayurvedic management treatment protocol, Shirodhara with Balashwagandha, Lakshadi Tel for 7 days, Manas Mitra Vatak, 250 mg BD after food with water 7 days, Kushtadi Gruta 5 ml BD after food with lukewarm water 8 to 49 days. Ingredients and actions: Brahmi improves memory, attention, cognition. Vacha enhances sleep, reduces restlessness. Shankapushpi anti-addictive, neuroprotective. Jatamansa sedative, improves sleep quality. Ashwagandha anti-stress, adaptogenic. Guduchi immunomodulator, anti-stress, anti-inflammatory. Outcomes: after 7 days, quality of sleep improved. 25% reduction in anger and aggressiveness, better understanding of desirable versus non-desirable activities, more calm and cooperative behavior. After 50 days, sleep quality further improved, concentration improved, renewed interest in studies, continued academic activities, better family interaction, and behavioral control. Ayurveda correlates ODD with Pitta Ummada. Rasayana Dravyas and Shirodhara act as a major anti nootropic, nosologic, and adaptogenic, improve sleep, memory, concentration, and behavioral regulation, enhances Vatishamatva. Action of therapy calms Vata, Pitta dosha, improves sleep quality, reduces anger, irritability, and aggression, enhances concentration, memory, and academic interest, strengthens immunity, overall well-being. Supportive measures, regular counseling guidance, structured study routine and support, stress management technique, sattvic ahara, and healthy lifestyle. Conclusion Ayurveda offers a holistic and effective approach in managing oppositional defiant disorder through balancing dosha, strengthening mental faculties, and improving immunity. Rasana drugs and Shirodhara with regular follow-up and counseling showed significant improvement in anger, sleep, concentration, and academic interest in cases. Thank you.
Thank you, Doctor. Thank you for the wonderful presentation. Thank you so much, Doctor. Next, we go to the another poster presentation. I'd like to invite Dr. Nayana Borate for the poster presentation on the topic correlation between Sujimukhi Yoni Vyavat and pinpoint cervical errors.
Respected Chairperson, judges, distinguished faculty members, delegates, and dear colleagues, good evening. I am Dr. Nirina Borate, second year postgraduate scholar from the Department of Sri Roga Evam Prasuti Tantra, Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune, working under the valuable guidance of Dr. Jayashree Patil ma'am. Today, I am presenting my poster titled Correlation between Suchimukhi Yoni Vapor and Pinpoint Cervical Os, an integrative review of Ayurvedic and modern perspectives. Female reproductive disorders have been described extensively in Ayurvedic classics. Many of these conditions can be interpreted through the lens of modern gynecology by comparing their etiology, pathology, clinical features, and management. One such condition is Suchimukhi Yoni Vapor, which shows remarkable similarity to the modern condition known as pinpoint cervical os or congenital cervical stenosis. The objective of this review was simple yet important: to explore whether the classical Ayurvedic description of Suchimukhi Yoni Vapor correlates with the modern concept of pinpoint cervical os and to understand its clinical significance from an integrative perspective. The term Suchimukhi literally means needle-like opening. In Ayurveda, it refers to an abnormally narrow reproductive passage. Interestingly, this description closely resembles the appearance of a pinpoint cervical os seen during gynecological examination. Acharya Charak describes this condition in the following verse. Garvini tu nisheveta yada vatakaram hitam tada garvashayadvaram sankocham yati marutat suchi agrasodrusham tasya योन्याः प्रजायते tam suchi vaktram jananti tadvaidya shastra paragah. This reference explains that excessive exposure to vata-provoking factors during pregnancy can lead to constriction of the reproductive passage in the female fetus, resulting in a needle-like opening known as Suchimukhi or Suchivaktra. What makes this description particularly fascinating is that it suggests a congenital developmental abnormality, a concept that closely parallels modern theories of congenital cervical hypoplasia and cervical stenosis. Now coming to Ayurvedic understanding of pathogenesis. The principal dosha involved is Vata, especially upon Vata. Aggravated Vata causes constriction and obstruction at the level of the reproductive tract, leading to narrowing of the Garbhashaya Dwara. The important Samprapti Ghatakas include Dosha, Vata predominance, Dusha, Atava and reproductive tissues, Srotasa, Atava Srotas, Srotadushti, Sangha, Adhisthana, Garbhashaya, and Yonimukhi. As a result, normal menstrual flow and reproductive functions become affected. Now, let us look at the modern perspective. Pinpoint cervical os is defined as an abnormally narrow cervical opening. It may be congenital or acquired. Congenital cases are commonly associated with Mullerian developmental anomalies, cervical hypoplasia, and abnormal embryological development of the cervix. Because of this narrowing, normal passage through the cervical canal becomes difficult. Patients may present with dysmenorrhea, scanty menstrual flow, infertility, recurrent pregnancy loss, difficulty in cervical assessment or instrumentation, obstetric complications in severe cases. The clinical photograph displays in the poster compare a normal cervical os with a pinpoint cervical os. The visual similarity between these findings and Ayurvedic description of Suchimukhi univapath is striking and forms the foundation of this comparative review. When we compare both conditions systematically, several similarities become evident. First, both conditions describe a narrowed cervical opening. Second, both are associated with developmental abnormalities affecting reproductive function. Third, both can result in menstrual disturbances, infertility, and reproductive challenges. And finally, both conditions significantly influence a woman's reproductive health and fertility outcomes. Therefore, although the terminology and theoretical frameworks differ, both systems appear to describe a similar clinical entity. This correlation has important clinical implications. A narrowed cervical opening can obstruct menstrual flow, hinder sperm transport, reduce fertility potential, and complicate the pregnancy and childbirth. Recognizing this condition early can therefore play a crucial role in reproductive management. Coming to treatment, Ayurveda focuses on correcting Vata imbalance and restoring normal patency of the reproductive passage. The commonly described therapeutic approaches include Snehana, Svedana, Yoni Pichu, Yoni Vati, and Uttarvasti. These therapies aim to reduce constriction, improve local tissue nourishment, facilitate normal passage, and support reproductive function. Another important classical reference from Charak Chikitsa Sthana states स्निग्धस्विन्नां तथा योनिन्दु स्थितां स्थापयेत् पुनः पाणिना नामयजिन्नां सौवृत्तां वर्धयेत् पुनः प्रवेशयेत् निःसृतां च विवृत्तां परिवर्तयेत् योनिः स्थानापवृत्ता हि शल्यभूता मतास्त्रिया. This reference highlights local corrective interventions aimed at restoring normal anatomy and function when constriction or abnormal positioning is present. In contrast, modern management primarily includes cervical dilatation, Higa's dilators, hormonal therapy where indicated, reconstructive procedures in severe cases. These interventions focus on restoring cervical canal patency and improving reproductive outcomes. An integrative approach may therefore be highly beneficial. Modern gynecology offers immediate anatomical correction, while Ayurveda provides a holistic framework for improving tissue health, functional restoration, and long-term reproductive well-being. To conclude, this review suggests that Suchimukhi univapath described in Ayurvedic classics closely correlates with a modern condition known as pinpoint cervical os. Both conditions involve narrowing of the cervical opening, share comparable clinical manifestations, and adversely affect reproductive health. Establishing such correlations helps bridge classical Ayurvedic wisdom with contemporary gynecological science and opens new avenues for integrative research and patient care. Further clinical studies are needed to scientifically evaluate Ayurvedic interventions and their potential role, improving fertility and reproductive outcomes in such patients. Thank you for your kind attention. I sincerely welcome your valuable questions, comments, and suggestions. Thanks a lot.
Thank you, Doctor. Thank you for making a valuable contribution to today's session. Thank you so much, Doctor. And next we go to the another paper presentation. I would like to invite Dr. B. Venkatalakshmi Padmavati for the paper presentation.
Good evening, everyone. I am Dr. B.V.R. Padmavati, final year PhD scholar from Dr. N.R.S. Government Ayurvedic College. Today, my topic is an Ayurvedic approach in management of Lavangadi. A case study. Position filters, history, chikitsa, and discussion. It is a Kshetra Yoga described in the Ayurvedic classics, characterized by painless, thin, bluish black or brownish discoloration patches on the face, primarily affecting the cheeks, forehead, and nose. It occurs due to the initiation of Vata and Pitta dosha, often triggered by factors such as mental stress, excessive sun exposure, improper diet, and lifestyle habits. In modern, yoga is commonly correlated with melasma and acquired hyperpigmentation disorder characterized by symmetrical brownish facial patches, although non-light turning Illness significantly affects facial appearance and can lead to psychological distress and reduced self-confidence. Case study, the patient name, she is a female, 39 years old, who is a homemaker from Vijayawada. The presenting complaints of the patient are brownish black discoloration of both cheeks and nose for about 1 week. It actually gradually increased in pigmentation while aggravated by sun exposure. On examination, we find that symmetrical hyperpigmentation patches present on face. Margins are well defined. Lesions are flat and non-scale. There is no erythema, tenderness, itching, or discharge. The Samaparchi, the patient is Vata Pitta. Mala is 1 time a day. Putra is Prakrita, Rita is Electro. Shabda is Prakrita, Sparsha is Anushna Snigdha, and Snigdha Sparsha. Drip Prakrita, Akriti is Madhyama. Nidana of Yoga. According to Ayurveda, it is mainly due to Krodha, Shoka, and Ayasa. In moderate, mainly due to UV radiation, exposure to UV radiation, more sun exposure, hormonal disturbances, systemic diseases, birth control pills or cosmetics, and etc. This are mainly Niruja, Tanu, Shavavarna, and Mandal. In modern, you can correlate it with bluish black patches, usually on cheeks, forehead, nose, and chin. Into ethiopathology of the disease, that is Samprati. Due to excessive Nidana Sevana, that is Shoka, Bala, or excessive exposure to the sun, leads to dosha prakopa, especially Vata and Pitta. That causes the dushti of the Shrotas, especially Rasa and Rakta. That is usually shown on the twak, that is skin, twacha of the mukha, which causes the formation of mandalas, which are Niruja, Tanu, and Shavavarna, that is Vyanga. Follow the protocol, which is Kumkumadhyataya Nasyam, 2 drops each nostril in the morning, that is body. Then Kumkumadhyataya Abhyanga after bath at night, Mahamanjishtatu Kashaya, then number after food, BD. Arogya Vardhini 1 BD. We can see the blackish patches on the temporal lesion are actually disappeared. We can see the after treatment. These are the patya and apatya I suggested to the patient. She has been following the same food and ahara vihara for about 3 months. That is Purana Shavle, Mudka, Gogruta, Koduma, Patola, Dadima, and Amlaki. In apatya, I told her to avoid excessive lavana katu vidahi, uru, tila, kuluta, and I also suggested her to avoid sweets, curd, and viharas like atapasavana, excessive exposure to the sun, Vegavadharana, Prodha, Shoka, Chinta, etc. My conclusion is although when there is a challenging condition, but with the management of Ayurvedic treatment protocol, especially focusing on Ahara and Vihara, and with the regular follow-ups of the patient with proper guidelines given to the patient, the present condition is treated within the 3 months of duration. So it is observed that correcting the diet, sleep cycle of the patient shows the better improvement. And Ayurveda has been proven to work wonders even in chronic conditions that are quite difficult to cure, like in diabetes.
Thank you, Doctor. Thank you for the insightful presentation. Next, I'd like to invite Dr. Churaka M.E. Vishaddev for the paper presentation.
Good evening, Mananda. This is Dr. T. M. A. Vishaddev, Department of Rashastra and Vaiseshika from Dr. NRS Government Ayurvedic College, Vijayawada. Thank you, Niramaya, for conducting this national level seminar. Today, I want to present Nirgundi Gugulu, a targeted Ayurvedic intervention for Sandhigata Vata. Introduction. Ayurveda is an ancient system of the medicine, emphasizes the prevention and management of diseases through natural remedies. The branch of Rashastra and Vaisyaja plays a pivotal role in Ayurveda by developing safe, effective, and scientifically prepared formulations that enhance the therapeutic outcomes. Various formulations has been mentioned in the classics with its own logical explanation. However, this logical explanation seems outdated now, and present time need scientific explanation in relation to pharmacological and biopharmacological studies. This presentation focuses on that scientific approach of the Nirgundi Gugulu, which is potent, palatable, economic, easy to administer, targeted intervention for the management of osteoarthritis. Discussion. Nirgundi Gugulu. Nirgundi Nishkasya Vyadin Gundayatiti Shariram Rakshatiti, that which protects from the number of diseases. It is proven for its anti-inflammatory, analgesic, anti-osteoporotic, antioxidant properties. Gugulu is well known for its anti-inflammatory, anti-arthritic, hypolipidemic, and antioxidant properties. Hence, Nirgundi Gugulu, a compound formulation, which is a better Vata Shamana, Sotahara, Vedana Stapana Aushadha, making it a promising option for addressing the underlying pathophysiology of the Sandhigata Vata. The reference is taken from the Prasandra Sara Sangraha Vata Vyadhi 28 to 30. Division of Nirgundi Gugulu. Gugulu is subjected to Sodhana by Dorianthra Svedana in the Tripula Vada according to Russell Nidhi chapter 8. Nirgundi Mola is collected, dried, made into fine powder. Shatugugulu is taken in Kalvayantra and pound this Gugulu by adding ghee. To this Nirgundi Mola Sorna is added. Pounding is continued till homogeneous mixture is obtained, then it is rolled into pills of size 500 mg. The dose is 500 mg BD and Anupana is Protha. This is discussion. Sandhi Vata. Sandhi means joint and Vata means Vata dosha. Astihi Samyoga Sthanam Sandhi. Sandhi is the place of union of two or more bones. Aggravation of Vata dosha in Sandhi leads to the Sandhi Vata. Acharya Charaka describes this disease under Vata Vyadhis and mentioned symptoms as Shota Vata Purna Dhurti Sparsha, Prasarna Abhinjanayaku Pravrutti Savedana. Acharya Susartha described signs and symptoms of this disease as Shota, Shola, and Hanti Sandhi. Sandhivata can be correlated with osteoarthritis in the modern science. It is a most common form of arthritis referred to the inflammation of the bone and joint capsule. It is a chronic progressive degenerative disorder primarily affecting the weight-bearing joints characterized by the breakdown of joint cartilage, subchondral osteosclerosis, osteophyte formation. It is commonly present at knees, hips, spine, and small joints in the hand. Elderly people, postmenopausal women, obesity, joint injuries, lifestyle disorders, occupational wear and tear of the joints are more susceptible to this osteoarthritis, and incidence of this is rising day by day. The pathophysiology of the osteoarthritis, which includes most complex pathways, simply we can understand the pathophysiology in this order. Aging, obesity, joint injury, genetic factors lead to the mechanical stress on the joint, which leads to condensate activation, release of inflammatory cytokines, activation of NF-kB pathways, increased production of MMPs, degradation of the cartilage matrix. It leads to the synovial inflammation, subchondral bone remodeling, and osteophyte formation, space narrowing, pain and stiffness. Finally, it leads to the osteoarthritis. Probable mode of action of Nirgundi and Gugulu. Pharmacology of Nirgundi and Gugulu. The Rasaguna Veera Vipakas are almost one and the same. The phytoconstituents in the Nirgundi root, it consists of the flavonoids, terpenoids, and phenolic compounds. So this is the anti-inflammatory activity of the Nirgundi. Stigmasterol, which is also known as anti-stiffness factor, which helps in suppression of the inflammatory cytokines. It reduces the IL-6, interleukin-6, interleukin-8, and TNF-alpha. And it also increases the IL-10, which is an anti-inflammatory cytokine. It helps in reducing the inflammation. Another phytoconstituent, that is beta-sitosterol, which reduces the ICAM1 expression, reduces the lymphocyte infiltration, which reduces synovitis, and in turn it reduces inflammation. Analgesic and counterprotective activity of the Nirgundi. Osteoarthritis pain arises from the inflammation of the synovium and heightened nerve sensitivity. Nirgundi exhibits Effects similar to the non-steroidal anti-inflammatory drugs, compounds such as agnoside and vitexin suppresses the cyclooxygenase 2 enzyme, thereby blocking the production of pro-inflammatory prostaglandins, which are the key drivers of the joint pain and swelling. Nigundin B demonstrate a strong ability to inhibit lipooxygenase enzyme activity. By doing so, it reduces the pain perception both centrally and peripherally. The structural integrity of joint depends on the collagen and proteoglycans. Inflammatory cytokines stimulate the release of destructive enzymes called matrix metalloproteases, which cause cartilage degradation. Suppression of the cytokines by stigmasterol significantly reduces the MMP activity, helping in preserve the cartilage thickness. Stigmasterol and the two important active ingredients act through their antioxidant properties to reduce the reactive oxygen species. This reduction in ROS inhibits the NF-κB pathway, thereby limiting the cartilage destruction. Beta-sitosterol regulates CASP3 gene, which is activated by the oxidative stress, reducing chondrocyte loss, supporting the cartilage preservation. In addition, beta-sitosterol activates ABCG8, ABCG5, and ABOE, which enhances the cholesterol efflux in chondrocytes and further help reducing the cartilage damage. These are the phytoconstituents in glucoresin, mainly E-glucusterone, Z-glucusterone, and glucusterols 1 to 5, beta-sitosterol. So now I can see the phytoconstituents and its mode of action. Glucusterones having anti-inflammatory action, they inhibit the NF-κB signaling. It reduces the pro-inflammatory cytokines. Monoterpenoids having anti-inflammatory, they modulate the cyclooxygenase and lipooxygenase pathways. Diterpenoid and triterpenoids having anti-arthritic and analgesic effect. They suppress the prostaglandin synthesis and reduce the joint inflammation. The steroids, which are present in gugulu, are having anti-inflammatory and immunomodulatory effects. The flavonoids having antioxidant effect, they neutralize the reactive oxygen species and helps in tissue repair. And the lignans having anti-cancer and antioxidant properties. Next, a probable mode of action of the Nirgundi Gugulu. Osteoarthritis is a degenerative joint disease characterized by the mechanical wear and tear of the cartilage alongside localized low-grade chronic inflammation. Nirgundi Gugulu treats OA through two primary mechanisms. One is chondroprotection, that is protecting the cartilage, and symptomatic management. It strongly protects the joint by reducing inflammation, swelling, cartilage degradation. It works by inhibiting the inflammatory mediators like prostaglandin and mitigating the oxidative stress. So Nirgundi Gugulu properly act through synergistic inhibition of inflammatory cytokines, enzymes, prostaglandins like TNF alpha, IL-6, IL-8, COX-2, LOX, PGA2, ROS, MMPs, ICAM1, and NF-κB mediated signaling pathways, promoting anti-inflammatory cytokines like interleukin-10, antioxidant defense, chondrocyte survival, collagen preservation, helps in reducing synovitis and joint inflammation, pain and stiffness, decreasing the cartilage degradation, protection of chondrocytes and extracellular matrix, and preserving the joint structure and function, thereby slowing up osteoarthritis progression. This integrated mechanism explains the efficacy of Nirgundi Gugulu in Sandivata. In conclusion, however, osteoarthritis with genetic origin, traumatic injury, or conditions with complete joint space reduction, severe structural damage like osteophytes, osteosclerosis do need interventions apart from oral medication and management with their specific lines of management. But Nirgundi Gugulu undeniably addresses underlying pathophysiology of osteoarthritis and act as a first choice Samanaushadhi after performing suitable Shodhana based on dosha for maximum benefit in osteoarthritis, which has prominent joint inflammation and joints prone to structural damage occurring in older age, postmenopausal women, obesity, joint injuries, and lifestyle disorders. Thank you.
Thank you, Doctor. Thank you for the valuable presentation. Next, I'd like to invite Dr. M. Rupalavanya for the paper presentation.
My name is Rupalavanya, PG scholar from Dr. NRS Government Ayurvedic College. Today I am going to present about therapeutic potential of Suktivata Rirasa in management of Suktivata with special reference to neuropathy. It is a unique herbo-mineral formulation promising maximum bioavailability.
Rasasastra and Vaishya Kalpana is a pharmaceutical branch of Ayurveda, which has thousands of formulations for curing various disease conditions. These formulations are well known for low dosages, quick therapeutic effects, as it includes herbal, mineral, herbo-mineral formulations made by Karaliya, Parpati, Potali, and Putli. Each formulation has unique way of preparation to avail maximum bioavailability in the human body. Suktivata Rasa is one such preparations. Suktivata Rasa is a reliable, potent Ayurvedic herbo-mineral Karaliya Rasayana, especially used in Suktivata, described in Rastarangini of 20th century. Suktivata Rasa is a simple herbo-mineral Karaliya Rasayana in tablet form administered per oral. It has three set of ingredients, that is Kajali, Trikatu, and Pippulu, and two Pavana Dravyas, Palasha Bija Kashaya and Nirgundi Patrasvaras. These are the ingredients of Suktivata Rasa that are Kajali and Kupilu Bija 1 karsha, Trikatu is taken 2 karsha, Nirgundi Patra and Palasha Bija are done bhavana 7 times each, is taken quantity sufficient. Procedure: all the powders are mixed thoroughly. And bhavnas are done with Nirgundi Swarasa and Palash Bij Kashaya for 7 times each. 250 mg pills are made, dried in shade and stored in airtight container. Dosage is 250 mg twice a day. The word Suktivata is divided into two words. Sukti means sleep, Vata means Vikrutavata. Sukti is Sparsha Agnanam. Suktivata translates to numbness or loss of sensation due to any Vata pathology. Suktivata itself is a disease. It is also a manifestation of some other diseases like Padaharsha, Tvagata Vata, Raktavrita Vata, Vata Rakta, and Vyanavrita Pran. Suktivata is described in 18 Anatmaja Vyadi in Charaka Samhita. Acharya Dalhana mentioned Suktivata is a Raktavrita Vata which is manifested as Sparsha Dvesha, Suktata, and Nistvava. Numerous Vatavyadi Nidana like Abhigata, Dhatukshaya, etc. aggravate Vatadosha which resemble neuropathy. Suktivata is thus simulated with neuropathy in modern sciences. Coming to neuropathy can be a symptom of central nervous system lesions and peripheral nervous system lesions. Commonly, neuropathy term is used to refer peripheral neuropathy. Diabetic neuropathy is a type of peripheral neuropathy, which is the major cause of neuropathy at present times. Pathological features can occur in both peripheral nerves. They include axonal degeneration of both myelinated and unmyelinated fibers with thickening of Schwann cell basal lamina, patchy segmental demyelination, and abnormal interneural capillaries with basement membrane thickening and microthrombi. These are the main symptoms of neuropathy, that is pain, numbness, hypersensitivity, and paresthesia. Neuropathy can occur in various diseases like radiculopathies, that is cervical and lumbar spondylitis, metabolic diseases like diabetes mellitus, obesity, rheumatoid arthritis, hypothyroidism, which cause entrapment neuropathies like carpal tunnel syndrome, etc., autoimmune diseases, hereditary neuropathies, drugs and alcoholism, neurological diseases, complication in various systemic diseases like vasculitis, malabsorption, deficiency states, vitamin B12 deficiency, copper deficiency, etc. Disorders of peripheral nervous system are common and may affect motor, sensory, and autonomic components. The pathology may be at nerve roots, nerve plexus, and nerve. Neuropathies may present as mononeuropathy, multiple mononeuropathies, and symmetrical polyneuropathy. If you look at the pathophysiology of Suktivata, neuropathy, damage may occur to nerve cell body or myelin sheath, which are categorized as axonal or demyelinating neuropathies. Suktivata is a predominant symptom of neuropathies, is common among neurogenic disorders affecting elderly population. The chronic nature of condition and involvement of Vata, Pitta, and Rakta makes it difficult to manage. This is the pharmacology of Suktivata Rasa. Kajali, Kupilu Bija, Samti, Maricha, Pippali, Nirgundi, and Palasha Bija. Everything has Vata Kapha Shamaka action. Kajali has Tridosha Hara action. Rasaguna Virya Vipaka, mostly the drugs are Katu Vipaka, Ushna Virya. But the one more thing to talk about here is Kupilu acts on Prabhava other than Rasaguna Virya Vipaka. It is a main drug in the Suktivata Rasa. It is a nervine stimulant, Vishagna, Deepana, Madakrut, Vyadahara, Balya, and Vajikara. Kajali is known for its Yogavahi Guna, multi-organ target drug delivery, augments the efficacy of formulation and enhancing bioavailability. Small dose, rapid action, desired results, long-lasting effects, palatability are specialities of Kajali. Sarvamayahara Vrishya Mata Dosha Trayapaha. Shuddha Pupili Sodahara Vedana Stapana Uttejaka Nadi Balya enhances nerve conduction in muscle and sensory pathways and acts as nervous stimulant. Strychnine blocks glycine receptor in spinal cord and brainstem. By blocking it, strychnine removes inhibition, leading to increased reflexes. Tilka-2 is an excellent bioenhancer with enormous benefits as it stimulates digestive juices and gut enzymes, inhibiting CYP450 enzyme. Bhavana with Palasha Bija Kashaya and Nirgundi Swarasa is uniqueness of this formulation. Both are Vataka Chamaka. Palasha is Krimigna, Deepana, Sangrahi, Kshara Shrestha, anti-helminthic, laxative, anti-inflammatory and antioxidant. Nirgundi, as we all know, is the best anti-inflammatory and antioxidant drug, is a Vedana Stap. Phytoconstituents of Bhavana Dravya, Palasha Bija and Gundipatra. Palasha Bija has natural oils. They support nerve integrity and reduce demyelination. Proteolytic and lipolytic enzymes. They reduce neuroinflammation and protein misfolding capacity. It will be proteolytic. It removes all the accumulated proteins around the nerves and reduces the inflammation. Palasonins are known for its anti-inflammatory property. Z-amirin and E-cytosterone influence nerve repair and regeneration. The anti-inflammatory of action is seen in Palasha Bija Kashaya by Z-amirin and palasonins, antioxidant action by monospermoside, neuroprotective enzymes by proteolytic and polypeptidase enzymes, membrane stabilization and metabolic support is seen by oils and lactose. These are the phytoconstituents of Nirgundi. Nirgundi, as we all know, have flavonoids, iridoid glycosides like agnoside, nigundoside, has anti-inflammatory, nerve repair, and cytoprotective actions. The unique flavonoids help prevent neuronal apoptosis by regulating MAPK and P13K pathways. Some derivatives act as calcium channel blockers, reducing hyperalgesia. Conclusion: Suktivata Ras acts in pathophysiology of neuropathy by reducing oxidative stress, anti-inflammatory action, neurotransmitter modulation. It balances excitatory and inhibitory signals, neuroregeneration, membrane stabilization. Numbness and paresthesia occurring as acute presentation due to life-threatening diseases like vasculitis, complete damage to nerves due to ischemia or hemorrhage, prolonged compression of nerve roots due to reduced joint space in radiculopathies can't be treated with single drug therapy. They need other interventions along with their respective line of treatments. However, neuropathies occurring due to inflammation of nerve roots in cervical and lumbar spondylitis, diabetic neuropathies with origin less than 1 year, as we all know, because Vata Vyadis are incurable after 1 year. Peripheral neuropathies occurring due to entrapment neuropathies like carpal tunnel syndrome and metabolic causes like hypothyroidism, obesity, pregnancy are treated with Suktivata Ras along with specific dosha management after performing proper Sodhana and Shamana. Thank you for giving me this opportunity. I thank Niramaya 2026 for being a part of this national seminar.
Thank you, Doctor. Thank you for delivering your presentation with such clarity and academic rigor. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Neha Patil for the paper presentation.
Respected panel of judges, coordinators, and fellow participants, myself, Dr. Neha, second year PG scholar of Dr. Annalis Government Ayurveda College, Vijayawada from Department of Shastra and Vaishya Kalpana, topic of my presentation is for hospital processing and therapeutic application of Shankha processing. Shankha is nothing but constant form of foreign bodies with virus and scientific name of forms gas. Chemical composition is calcium carbonate along with other pharmaceutical processing of Shankha has mainly two steps, Shodhana and Marana. Shankha Shodhana done by Dola and Svedana method, but liquid medias and time taken for the procedure varies according to different strengths. In Rasa Tarangini, Jambir Vari and Swarasa Kandi Kandavias Swarasa given as the liquid media. Next step for the preparation of Shankha is Marana. The Pankha method we use for Shankha preparation. According to Rasakarangi, the Shankara includes in Shara Samhita and given three Prabhutas, different explanations like a different preparation like this. In nearby partner, procedure described as to the Shankara keeping kept in Shara Samhita and give Gajaputra. Before second Gajaputra isolate with Kumari Swasa, Nimbu Swasa, and Vipan Chetri. After dying, the Shakutas are created in Sharava and Sati Vandana. Give another Guruna, same procedure in one more time. We will get pale white orange like temperature profile for the correction of Shankabhasma is shown that temperature maintained at 70 to 80 degrees Celsius for 3 hours. In Marana, there are three distinct stages. First is initial heating, room temperature to 500 degrees Celsius, approximately 1.5 to 2 hours. Input temperature 700 to 900 degrees Celsius, peak zone for 1 to 2 hours. The self will peak temperature fallen back to room temperature, it takes 24 hours. Thermal treatment at 500 to 900 degrees Celsius. Not only removes anaerobic carbon transfers, but also decomposition from the organic matter into gaseous form. Transportation of carbonate in that begins at 300 to 70 degrees Celsius and is complete at 600 to 700 degrees Celsius. Temperature profiling Gajaputa using EMF. Rate of temperature increase 5 to 10 degrees Celsius per minute up to 800. Hold time is at 800 degrees Celsius for 2 hours. Turn off EMF to self-cool overnight to mirror traditional sheet cooling profile. Role of Pavana Dravya in Marana procedure. Aloe vera contains 98.5% of water and glucomannan, amino acids, lipids, sterols, vitamins, and polysaccharides. Aloe vera phages help to wet grind the calcium and calcium carbonate particles smoothly and binds them easily, leading to parent formation. Most importantly, modern pharmaceutical industry has been using biopolymers like chitosan, xanthan, and pectin as substrate constant crystallization of calcium carbonate. Aloe vera pulp rich in polysaccharide may have similar function of biopolymers during the incineration of shanka. Citric acid in the lemon juice address and calcium carbonate crystal during purification by acting as gelatin ligands and sulfates, which reduces particle agglomeration and lower the fine material hardness. The citric acid present in the lemon fluid reacts with calcium, which improves its absorption with calcium carbonate and argonite form. In exciting patterns, Soviet Shanka, same weak size, and of Soviet Shanka, where observed a slight difference of deep early interfering the influence of Shodhana over the intraatomic structure, where the interplanetary spacing of the atom has reduced. Both Ashogita and Soviet Shanka splashes in autotrophic system, but observe the change in the vicinity of the phase after Shodhana. These changes can attribute to the object of Shodhana, which is preliminary procedure makes metal and minerals suitable for Marana. Shodhit Shankar, after subjecting it into one Gajaputa changes to calcite. Here the polymorphic form of CSE cluster forms autonomic system changes to the another polymorphic form of hydrogen system of crystallization. Shankabhasma after 3 Puta contains calcium carbonate and calcite form, which is metal calcium hydroxide and lime. Shankabhasma properties, heat area, vanilla, gravity, government. According to library control, and also still something to arrange understanding the body for the application of Shankabhasma in respiratory therapeutic utilities explain with its Anahana as well. Nabisara and Gadani with Nibuswarasa and Nabi Mata and Churna Therapeuta with Amaliki Churna in Yumoroga with and Yavakshara, but Paranam Churna and with Panchakarma and Mashwasroga, Varaki Churna, Paragdi Nivana, Vishnundi, Parvamana, Vitarida and Ramuka, Parakaparduda and Parvagranti, Yelpa with Mulakshara Basa. Other references of therapeutic application of Shankabhasma in Netraroga, Hika, Visuchika, Pittavidagda, Vidavarta, Shankabhasma can be used. Shankabhasma is also effective in Pitta Dosha Visheshan, Rasarakta and Mansadhatu Visheshan, also Yakrut Kiliha, Bakvashay, Vanchanendriya, Netra and Mukharoga. It is helpful in GRD, hyperacidity, Tarunda Pitika, acne vulgaris, and vomiting. It is useful. Dosage of Shankabhasma is 2 to 3 according to Rasa Tarangini and 250 to 300 mg according to air. Mode of action of Shankabhasma in gastrointestinal diseases with special reference to Amla Pitta Ayurvedic perspective. It is Dipana and Pachana, digest Ama and does Agni Dipana, Pitta Shamana, possesses Sheta Virya and Madhura Vipaka, which directly counteract the Vikshna, Ushna and Amla attributes of aggravated Pitta. Kshari action due to its inherent Kshara property, it immediately counteracts and binds the Amla and Dravata of the vitiated Pachapitta. It is Grahi and Vata Lunumana. Grahi traits absorbs excess liquid secretions in the gut, which causes associated nausea and sour vomiting. Modern perspective, high acid neutralizing capacity, calcium carbonate undergoes immediate chemical reaction with hydrochloric acid. It is cytoprotective and anti-secretory properties. It has antispasmodic effect. Some research update regarding Shankabhasma. Study on anti-acid evaluation of Shankabhasma. Evaluation as an antacid was carried out using preliminary and test acid neutralizing acid rosette rice test. During PAD, the product should raise pH above 3.5 within 10 minutes. Shankabhasma prepared by traditional method and open furnace have achieved pH 12.23 and 7.70 respectively at the end of 10 minutes during the PAD, and hence this product can be labeled as antacid and subjected to further evaluation. In ends, testing the total microequivalent of the acid neutralizing property is significantly greater. Anti-ulcer activity of Shankabhasma, calcium and other major trace element of Shankabhasma were potassium, sodium, ferrous, cobalt, manganese, copper. Most of the elements present in Shankabhasma have been reported to the scavenging action in free radical generation. While oxidative stress induced free radical generation is one of the prime cause of cancer formation, we have also been reported calcium and magnesium has antioxidant properties and has mediatory scavenging action in free radical generation, and thereby they can be protecting of concluded standardized processing. Traditional Sodana and Marana process convert Shanka into highly biocompatible 5 nanomolar therapeutic drug. Therapeutic efficacy. Shankabhasman serves as potent fast-acting alkaline formulation primarily indicated for gastrointestinal disorders like Amla Pitta, Grahani, Chatti. Calcium has an acid neutralizing action. Shankabhasma is responsible for its anti-ulcer action. Purified Shankabhasma has promising cytoprotective and anti-secretory action, and that may be due to its oxidative stress negating action in gastric tissue. Clinical safety, when prepared strictly adhering to classical aesthetics and administering therapeutic dosage at a visible excellent safety profile with minimal adverse effects, futures the standardization of temperature pattern and total heat required for the perfect and safe product is traditional to the method, as there is variation in the available data.
Thank you, Doctor. Thank you for the well-explained presentation. Next, I'd like to invite Dr. T. Durga Sai Lakshmi for the paper presentation.
A warm good evening, everyone. Myself, Dr. T. Durga Sai Lakshmi, MD Scholar, Department of Kaya Chikitsa, Dr. NRS Government Ayurvedic Medical College, Vijayawada, Andhra Pradesh. Bone health has become a major concern in today's world. Many individuals, irrespective of age, are experiencing symptoms related to asthikshaya, such as bone weakness, joint pain, reduced bone density, and an increased risk of fractures. When discussing bone health, most people focus only on calcium supplementation. However, strong and healthy bones depend on much more than calcium alone. Unfortunately, due to widespread misconceptions and myths, many people believe that calcium alone is sufficient for preventing bone loss and maintaining bone strength. In this presentation, we will explore the concept of misconceptions of ahara leading to asthikshaya with modern correlation. Formation of asthidhatu. Prithivyagnya aniladina samgatah soshmana kharatvam prakarutyasya jayate asthitatu nrunam. Mainly, asthidhatu is formed from medo dhatu. With the aggregation of Prithvi, Agni, Anila, roughness is attained during the formation of Asti. Functions of Asthidhatu. Karma, Asthini, Dehadharanam, Majja, Pushticha. Asthidhatu is responsible for appropriate posture of the body. It also nourishes next dhatu, namely Majja dhatu. Now we will see the concept of Ashraya, Ashraya Bhava of Vata and Asti in Asthikshaya. In Ayurveda, Asthidhatu is considered the Ashraya of Vata dosha, while Vata is the Ashrayi. This unique relationship is explained through the principle of Ashraya Ashrayi Bhava. Unlike other Dhatu dosha relationships, where an increase in one leads to an increase in the other, Vata and Asti have an inverse relationship. Now we will see the role of today's Ahara in Astikshaya. Modern dietary habits often aggravate Vata and weaken Asti Dhatu. Excess consumption of processed foods and junk foods, carbonated soft drinks containing phosphoric acid, low intake of milk, ghee, sesame and nourishing foods, excess fasting, crash dieting and meal skipping, deficiency of calcium, protein, magnesium, vitamin D, vitamin K2, zinc and boron, excess caffeine and alcohol consumption. These dietary practices possess Laghu, Ruksha, Khara qualities which increase Vata and contribute to Asti Dhatu Kshaya. Now we will see the lifestyle modifications. Role of today's Vihara. Several modern lifestyle in Asti Kshaya. Sedentary lifestyle with lack of weight-bearing exercises, excessive screen time and indoor living causing vitamin D deficiency, chronic stress and sleep deprivation, overexertion and irregular daily routines, excessive travel and night shifts. These habits disturb Vata dosha and impede Dhatu nourishment, leading to degeneration of Asti Dhatu. Symptoms of Kesha, Loma, Nakha, Smashnu, Vijaprapatanam, Shramaha, Gneyam, Astikshaye, Lingam, Sandhi Shaidilyam Evacha. Now we will see the composition of bone according to modern. Bone composed of organic matter 25%, inorganic matter 65%, water 10%. In organic matter, bone cells and intracellular matrix are included. In inorganic matter, crystalline hydroxyapatite amorphous ions are included. Beyond calcium, what bones actually need? Living tissue. Bones are dynamic structures, not just blocks of chalk. Dual matrix require a flexible protein framework and a hard mineral crust. Team effort. Calcium cannot build or protect bone density entirely on its own. Nutrients which are useful for bone strengthening and their functions and sources. The absorption catalyst and structural scaffold vitamin D. Vitamin D plays a major role in absorption of calcium from gut. Core matrix minerals. Phosphorus, magnesium, potassium plays a major role in bone strengthening. The traffic directors and trace elements. Vitamin K2, zinc and manganese, boron and silicon. Also very important in strengthening of bone. Myth. More calcium always means stronger bones. The reality is taking excessive amounts of calcium does not make bones extra strong. Once your body meets its daily requirement, the excess is excreted. Over supplementing can lead to hypercalcemia, constipation and increased risk of kidney stones. Myth 2. Calcium works perfectly on its own. Calcium cannot be properly absorbed or used by the bones without vitamin D. Additionally, bones need a matrix of other nutrients like magnesium, vitamin K2 and protein to build up proper bone tissue. Myth 3. Dairy is the only good source of calcium. The reality is, while milk, yogurt and cheese are excellent calcium sources, they are not strictly required. You can get highly bioavailable calcium from dark leafy greens, almonds, fortified plant-based milks, etc. Sesame seeds contain 8 to 10 times more calcium than milk. Soaked and fermented ragi contains 3 times more calcium than milk. Dried moringa leaves contain 10 to 17 times more calcium than milk. Myth 4. Nutrition alone will prevent osteoporosis. The reality is bones are living tissue that respond to physical stress. Dietary intake must be paired with weight bearing and resistant exercises such as walking, stair climbing and weightlifting. Movement stimulates bone growth and maintains density much better than a diet alone. Myth 5. Only older women need to worry about calcium. The reality is, while postmenopausal women are the most vulnerable to bone density loss, men and younger adults are also at risk. More importantly, humans reach their peak bone mass by their late 20s or early 30s. Building a strong bone foundation through proper calcium and vitamin D intake during youth is critical for preventing osteoporosis later in life. Importance of water in bone matrix. Water is a critical, often overlooked component of bone health, making of roughly 10% to 20% of mature bone mass. It is not just passive moisture. Water is structurally and chemically bound to the bone matrix, providing the essential fluid dynamics required to prevent fractures and keep skeletal tissue alive. The conclusion is bone health is a lifelong dynamic process. Building a high peak bone mass by age 30, primarily through nutrition and weight bearing exercise, is the best defense against age related bone loss. Maintaining lifelong skeletal strength requires adequate calcium, vitamin D, minerals, collagen, water, and active physical habits, while minimizing smoking and excessive alcohol intake and lifestyle modifications. Thank you.
Thank you, Doctor. Thank you for presenting this topic in a systematic and engaging manner. Next, we go to the another paper presentation. I'd like to invite Dr. Nitin Vishnudas Tudade for the paper presentation. I would like to invite Dr. Nitin Vishnudas Tudade for the paper presentation on the topic Fisher Nano, a comprehensive surgical review with recent advances and Ayurvedic correlation. Thank you, Doctor. Next, we go to the another paper and poster presentation. I'd like to invite Dr. Sachin Sahadev Narude for the paper and poster presentation.
Good afternoon, respected judges, teachers, and colleagues. I am Dr. Sachin Sadanavte, secondary PG scholar, Department of Marthutya, under guidance of Dr. Priyanka Dhamkar. I am presenting a Krumi worm infestation in Ayurveda. Krumi roga refers to a disease caused by parasite or worms. Ayurveda has described this condition in detail in Charaka Samhita, Susur Samhita, and Ashtanga. How the Krumi roga can affect all age groups, children are especially vulnerable. According to World Health Organization, nearly 1.5 million people worldwide are infected with soil-transmitted elements, making it a major public health concern. The causative factors are Nidan include improper dietary habits such as excessive sweet, stay heavy, and incompatible foods, lifestyle factors like daytime sleeping, lack of exercise, and poor digestion also contribute. Environmental factors such as poor hygiene, contaminated food, and water and open debate further increase the risk of infestation. The pathogenesis or samprapti begins with mandani, meaning impaired digestive fire. This leads to the formation of ama, which provide a favorable environment for the growth of krumi. Kapha supports the growth. Pitta causes inflammatory manifestation, and Vata produces symptoms such as pain and discomfort. Ayurveda classifies krimi into Bahi krumi, which are external parasites affecting skin and hair, and Abhyantara krimi, which are internal parasites. Internal parasites are further classified as Purushadal, Kapaja, and Raktaj krimi, depending on their site of habitation. The common clinical features include loss of appetite, abdominal pain, anemia, weight loss, nausea, vomiting, energy, constipation, and passage of worms in stool. In children, teeth grinding during sleep, known as dantaharsha, failure to thrive, lethargy, and poor growth are important indicators. Many Ayurvedic descriptions closely correlate with modern parasitic disease. For example, Purusha's krimi can be compared with roundworm infestation, Anthrax with pinworm infestation, and Raktakrumi with blood-borne parasitic disease such as filariasis. Diagnosis in Ayurveda is based on Nidan Panchak, clinical examination, and therapeutic response. Modern investigation includes stool microscopy, synthesis showing eosinophilia, the cellotape test of pinworms, serological test, ultrasound, and molecular diagnostic techniques. The management of Kromerog is based on three principles. First is Nidan Parivarjana, which means avoiding causative factors. Second is Apakarshana, which involves expelling parasite through therapies and medicine. Third is Prakriti Vigata, which means creating an unfavorable environment of parasite survival by improving digestion and reducing harm. Important Ayurvedic drugs include Vidanga, Palasya, Jamoda, and Nimba. Active compounds such as Imbelin from Vidanga and Palasonin from Palasya have demonstrated significant anti-helminthic activity in studies. Classical formulations like Chromimulgaras and Vidangas are widely used in prevention plays a vital role. Ayurveda recommends proper hygiene, consumption of freshly prepared food, use of bitter and pungent substance, regular hand washing, wearing footwear, and periodic deworming. This principle closely aligns with modern public health measures and WHO recommendations. In conclusion, Krimeroga remains an important health problem, especially among children. Ayurveda provides a comprehensive approach to prevention, early diagnosis, dietary regulation, and effective treatment. Integrating Ayurvedic principles with modern deworming programs can contribute significantly to improving child health and reducing the burden of parasitic disease. Thank you.
Thank you, Doctor. And one more poster presentation is there.
Good afternoon, teachers. I am Dr. Sachin Saudanarutte, a PG scholar in the Department of Computer under the guidance of Dr. Priyanka Dhamkar. I am presenting my poster title Study the Panchakarma Procedures in Kumar mentioning Ayurveda authentic text. Panchakarma is an important branch of Ayurveda that focuses on detoxification, disease prevention, and restoration of health. It helps improve immunity, physical health, and mental well-being. In pediatric Ayurveda, known as Kumar Buddha, patient care is required by applying Panchakarma procedure because children are physiologically different from adults. The objective of this study was to investigate Panchakarma procedure described for children in classical Ayurvedic text and to evaluate their implementation in current clinical practice. For this study, information was collected from authentic Ayurvedic texts such as Charaka Samhita, Sushruta Samhita, Ashtamrudaya, and Kasha Samhita. Additional data were gathered from journal articles, dissertation, and hospital record related to pediatric functional practice. The result showed that Snehana or oleation therapy is considered the first line of treatment in children. Both Churuk and Kashyapa recommended administering mild and appropriate quantities of snake. Regarding Snehana, Kashyap provided detailed description of for pediatric use and Pindus weather is commonly practiced in many pediatric conditions today. Since childhood is naturally codominant and delicate, Murdu woman or gentle emesis is considered suitable when indicated. Viragin is generally avoided in children, except during emergency. In situation, mild purification methods are preferred. Classical texts often recommended Basti as a safer and more effective alternative. Charaka especially emphasizes Basti as one of the most beneficial Panchakarma therapies for children. Hormuz Susrut and Bhagavad advise avoiding immunosuppressive whereas Kashyap allows its use when it infers under proper supervision. Among the different forms of nursery, Pratimmersion assay is considered the mildest and safest for pediatric use. Raktamotion or bloodletting therapy is contraindicated in children below 16 years of age. Current clinical practice also shows frequent use of Murjani care procedure in conditions such as Balapakshakatma, Atvata, and Manodurubali. In conclusion, childhood is a critical period of growth and development. Panchakarma therapies can provide significant benefits in pediatric care when applied with appropriate modification, scientific understanding, and careful monitoring. Properly administered Panchakar helps restore dosha balance and supports comprehensive management of various childhood disorders. Thank you.
Thank you, Doctor. Thank you for the well executed paper and poster presentation. Thank you so much, Doctor. Next, we go to the final poster presentation. I would like to invite Dr. Deepak Kishore Nandre for the poster presentation.
Hello, myself Dr. Divyanand. I am presenting you final paper presentation of call. Call is a common pressure in the skin condition. Call is localized speaking of skin that develop due to increased pressure or friction. It commonly occurs on feet, toes, but may also occur on hands. One are not frontal illness and us different among words comfort they may perceive. Squam is small, well-defined area of the gut skin caused by excessive pressure or friction on particular body. Causes are ill-fitting footwear, high heels, walking barefoot frequently, abnormal pose structure, preventative factor, or one deformity such as periods or protective. Types of forms are hard forms or fast compost and having option set of codes are things soft form operating between force, white and operating between lecture, acid form, small forms or solar fruit, often known as cluster. Sign of symptoms are cut, hard skin, based form of the skin, pain or tenderness for skin, discomfort when using socks. Risk factors are poorly fitting shoes, deformities, elevated pressure on feet, lack of protective footwear, depression or prolonged standing. Diagnosis can be done on physical examination, medical history assessment of footwear or structure. The treatments are removed of pressure source, proper comfortable footwear, form pads and cushions, salicylic acid preparations, regular foot care is also effective surgical correction of underlying deformity, like excision of point biopsy are also preventive techniques where there is that prevention of reactive focal change, use protective clothes during effort. If green and hot choice, use cushioned insoles, avoid excessive friction and pressure. One has some complications such as pain during walking, difficulty for common daily activities, infections, returns if pressure persists. Thank you.
Thank you, Doctor. Thank you for the insightful poster presentation. As we reach the conclusion of Niramaya 2026 National Seminar Paper and Poster Presentation, organized by Ayurveda. It is my privilege and honor to stand before you and express our heartfelt gratitude to all those who have contributed to making this academic event a remarkable success. Over the past few days, we have witnessed an inspiring journey of learning, research, and innovation and academic exchange. Niramaya was envisioned as a platform where students, scholars, academicians, researchers, and practitioners could come together to share ideas, present their work, and contribute to the advancement of Ayurvedic science. Today, as we conclude this seminar, we can proudly say that this vision has been fulfilled through the active participation and dedication of every individual associated with this program. First and foremost, I would like to extend my sincere appreciation to all the presenters who have participated in this seminar. We have had the privilege of listening to a wide variety of research papers and poster presentations covering diverse topics in Ayurveda and allied sciences. Each presentation reflected the hard work, commitment, and scientific curiosity of the participants. Whether you were presenting original research, clinical observation, literary reviews, or innovative concepts, your contributions has enriched this seminar and strengthened the culture of academic inquiry within our profession. Research is the foundation upon which the future of Ayurveda will continue to grow. Every research question explored, every observation documented, and every idea presented during this seminar represents a step forward in expanding our collective knowledge. Therefore, I would like to congratulate and thank each presenter for their valuable contribution to the academic community. I would also like to express our deepest gratitude to our respected panel members. Your expertise, scholarly guidance, constructive criticism, and thoughtful observations have been invaluable throughout this program. Beyond evaluating presentations, you have inspired participants to think critically, improve their research methodology, and strive for higher standards of academic excellence. Your dedication and willingness to support young researchers have played a crucial role in the success of Niramaya 2026. My sincere thanks also go to the principals, professors, heads of departments, faculty members, and institutions that encouraged and supported participants in presenting their work. Your commitment to nurturing future researchers and academicians is essential for the continued growth and credibility of Ayurvedic science. I would also like to acknowledge the efforts of all participants and attendees who joined us from different parts of this country. Your enthusiasm, active involvement, and commitment to learning transformed this seminar into a vibrant platform for intellectual exchange. The meaningful discussion, constructive feedback, and collaborative spirit witnessed throughout the sessions are a testament to the strength and unity of our academic community. No event of this scale can be successful without the efforts of a dedicated organizing team. Therefore, I would like to extend my heartfelt appreciation to our every members of the Ayurveda team, from drawing and coordination to communication, technical support, presentation review, and scheduling and overall management. Countless hours of efforts have been invested behind the scenes. Their dedication, teamwork, and commitment have ensured the smooth and successful conduct of this seminar. As we conclude Niramaya 2026, let us remember that this is not merely the end of a seminar. Rather, it is the beginning of new ideas, new collaborations, new research initiatives, and new opportunity for growth. The knowledge shared here should continue to inspire us in our academic, clinical, and research endeavors. Let us carry forward the spirit of scientific inquiry, lifelong learning, and professional excellence that has been reflected throughout this event. Ayurveda has flourished for centuries because of the contributions of dedicated teachers, scholars, clinicians, and researchers. It is now our collective responsibility to continue that legacy by promoting evidence-based research, academic integrity, innovation, and meaningful scientific communication. On behalf of Ayurveda, I once again express my sincere gratitude to every presenter, panel member, faculty member, student, researcher, practitioner, institution, and supporter who has been part of Niramaya 2026. Your participation and encouragement have made this seminar a memorable and successful academic event. Thank you for your trust and your support and your valuable contributions. We hope to meet you again in future academic programs and scientific events organized by Ayurveda. Until then, continue learning, continue researching, continue sharing knowledge, and continue contributing to the advancement of Ayurveda. Thank you all once again.